Good morning, I should say. This hearing is called to order. I recognize the presence of a quorum of committee members. Members of the committee in attendance today, this morning, are Council members Cindy Bass, Council member Kendra Brooks, Council member Mark Squilla, Council member Helen Gim, Council member Kenyatta Johnson, Council member Catherine Gilmore Richardson, Council member Curtis Jones, and Council member Derek Green. This is the public hearing of the Committee on Fiscal Responsibility and Intergovernmental Cooperation. The purpose of this public hearing is to hear testimony on Resolution 200699. I introduced this resolution with co-sponsors, Council members Johnson, Squilla, Heenan, Gilmore, Richardson, O'Neill, Gim, O, Bass, Jones, and Gautier. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We're using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phlcouncil.com. Clerk will now please read the title of the resolution before this committee today.
Authorizing the Fiscal Stability and Intergovernmental Cooperation Committee to hold hearings examining the economic impact of the coronavirus-related restrictions on Philadelphia's restaurants and other significantly affected businesses, and to explore how these actions will impact the safety of our citizenry and the City of Philadelphia's 5-year financial plan.
Thank you. First, I want to thank my colleagues, all of you, for being here today. I know we've all been working crazy overtime to try to respond to the growing needs of all of our communities. I've seen the letter writing, the briefings, the impact statements, the conference calls with our state and federal representatives, and I've sat with all of you in our council hearings. And all our goal is in an effort to help our people and our businesses get through this extraordinarily difficult time. I want to say a special thanks to my task force colleagues, Councilmember Kenyatta Johnson and Councilmember Cindy Bass. Thank you for your continued support to find solutions for the struggling industries we're about to hear from today. Just yesterday, special thank you to Councilmember Kenyatta Johnson. We spoke with Senator Casey and our Philadelphia congressional delegation to talk about where things stand, how we can get resources to hospitality businesses and their employees as quickly as possible. And we're all here today because the hospitality industry has been decimated by this pandemic. The unfortunate truth is that this devastation has happened to them, and not because of them. They did nothing wrong. And when I talk about hospitality, I'm including restaurants, we're including hotels, arts and culture, and fitness centers. All of these businesses are focused on how we bring people together for a social experience. And they're all suffering and on the verge of closure. Many have already closed, which will have a long-lasting, very negative impact on our people and our city. I appreciate and welcome members from the Kennedy administration who've been managing these complex and ever-changing pandemic circumstances. And let me say this, there is no one here today who should doubt the work of the administration and these folks and what they're doing to protect the health and safety of everyone in Philadelphia. This is uncharted territory. And as our majority leader actually said last week in council, no one had a playbook for this event. It's uncharted for all of us, and we appreciate the leadership that encourages mask wearing and safety precautions that protect lives. But it's also important that we maintain transparency in what we do and how we do it. So with that in mind, we expect to hear about how the decision-making process has been occurring on business restrictions, what data, what information is being used or monitored, how guidelines are being developed, how the enforcement is applied across industries, and discuss where areas of opportunity exist to improve that process going forward. We're all in this together. This is a constructive hearing today. So having an open dialogue and an open mind to suggestions today is our goal. So with that, we have a lot of people to hear from today, so let's get started. Mrs. Gerbach, please call the first panel of witnesses.
For our first panel, we'll hear from Jim Engler in the mayor's office, and the following people will also be available for questions from members. Dr. Farley, Don Somerville from the Commerce Department, Rob DeBow, who's our Finance Director, and Michael Carroll from Otis.
Good morning. I guess we could start with Jim Engler, our Mayor's Chief of Staff.
Good morning, Chairperson Dom and members of the Committee on Fiscal Stability and Intergovernmental Cooperation. My name is Jim Engler, Chief of Staff to Mayor Kenny. Along with me to answer questions are Health Commissioner Dr. Thomas Farley, Deputy Commerce Director Don Somerville, Finance Director Rob DeBow, and Deputy Managing Director for the Office of Transportation Infrastructure Systems, Mike Carroll. Thank you for allowing me to testify on Resolution 200699, which authorizes hearings to discuss the economic impact of the coronavirus-related restrictions on Philadelphia's restaurants and other significantly affected businesses. As this committee knows, the coronavirus pandemic has had a devastating impact on the health of Philadelphia's residents. As of December 14th, more than 81,000 Philadelphians have had infection with the virus, and more than 2,100 have died from their infections. Currently, more than 920 people are hospitalized in Philadelphia with COVID-19. For comparison's sake, Philadelphia's peak hospitalization rate last spring was just over 1,000 individuals. Rising case rates and hospitalizations has forced the administration to make very difficult decisions on how to best protect residents as we navigate our way through this pandemic. It is important to emphasize that our priority is, was, and always will be the health and safety of Philadelphians. This priority has guided our decision-making every day for the last 10 months. While we know much more about the COVID-19 virus now, and the first vaccines are becoming available, the most effective way to prevent people from becoming infected, hospitalized, and possibly dying from COVID-19 is to slow the spread of the virus through social distancing. COVID-19 is spread most efficiently indoors when people are close to each other, and especially when not wearing masks. In imposing additional restrictions in the current fall-winter wave of the pandemic, we focused on activities that posed higher risks of transmission, specifically where people from different households can come in contact with each other. We focused on indoor gatherings of any kind, indoor exercise activity, and indoor dining where mask wearing is impossible. 3 weeks after the city imposed these restrictions, Governor Wolf imposed substantially similar restrictions across the Commonwealth. This obviously poses great challenges to restaurants and other businesses. This fact is not lost on our administration, and that is why we began work in May to support businesses by coordinating and permitting outdoor commercial activity. Our staff with the Streets Department, Licenses and Inspections, Health Department, Commerce Department, Planning Commission, and Otis, working with our partners here in City Council, have all been deeply engaged in coordinating with businesses, sharing best practices, and exploring innovative solutions to common issues that arrive in conducting business in the right of way. We have participated and convened numerous conversations and are preparing this winter to explore creative ways to facilitate outdoor dining and related outdoor commercial activity. To date, hundreds of businesses have been sustained over the past several months through opportunities that have been made available to serve food at sidewalk cafes, streeteries, and through temporary street closures throughout the city. These opportunities, as well as others, have been made at no cost to businesses and, thanks to recent legislation, have been extended through at least December 31, 2021. Recognizing that our businesses' needs extend beyond facilitating alternate ways of operating, the administration has also provided financial assistance. As soon as the initial rounds of business closures took effect in March, the city announced a $13 million small business relief fund, which supported over 2,000 small businesses. While the need was far greater than the amount available, these funds served as a critical lifeline as we waited for the federal government to provide more robust aid. The Payroll Protection Program loans infused billions of dollars into our region, although we know that many small and minority-owned businesses were not able to access these loans for a variety of reasons. Again, the city stepped in to provide an additional $30 million of funding to supplement the Commonwealth's $40 million of statewide funding for businesses in Philadelphia with less than $1 million in annual revenue, with a heavy emphasis on the hard-hit industries, businesses in low to moderate income areas, and owners from historically disadvantaged backgrounds. And in just the past week, City Council approved an additional $20 million that we will use to prevent the closure of critical businesses that continue to be severely impacted during the COVID-19 pandemic. We are currently evaluating how to best distribute these funds to businesses in need. Philadelphia small businesses are crucial to the health and well-being of our communities, providing tens of thousands of jobs for residents, along with countless goods and services. We're proud to commit more funding for much-needed relief to struggling small businesses. Yet even with these various rounds of financial assistance, local small businesses are still in overwhelming need of more support, estimated at more than $300 million. The city will continue to advocate for state and federal governments to provide more flexible funding to meet the needs of Philadelphia small businesses impacted by the pandemic. Finally, the pandemic has had a devastating impact on the city and school district's finances. Before the pandemic hit, the city had built up its largest ever fund balance at $438 million and had made its first ever contribution to our rainy day fund. Now, our projected fund balance stands at less than $23 million, even after we took a series of budget balancing actions in response to a loss of $750 million in revenue through the end of fiscal year 21. With the pandemic's continued spread, even that narrow fund balance is now threatened. If revenue for the remainder of the fiscal year is as weak as it was during the first quarter, we could see further revenue declines of between $70 million and $100 million, which would exceed our fund balance, necessitating additional cuts to restore balance. As for the school district, its latest quarterly report projected that its FY21 tax revenues would be over $70 million lower than they were in fiscal year 19. The largest projected reductions were $26 million in the use and occupancy tax and $23 million in the liquor tax. Both of these taxes are likely to see further reductions if the pandemic surge is not abated. Make no mistake, while this testimony paints an unfortunate and bleak financial picture for businesses, the city, and the school district, it would undoubtedly be much worse had we not taken the steps we did to mitigate the spread of this deadly virus. We are hopeful that with the modest restrictions temporarily reimposed first by the city and now statewide by the governor, vaccines becoming available, and a new incoming administration in Washington, we will see brighter days ahead. Thank you again for the opportunity to testify today. My team and I are happy to answer any questions you may have.
Thank you, Mr. Engler. Is there another testimony from the mayor's legislative director, or are they just here for questions?
The rest of our folks are just here to answer your questions.
Okay. So I have a few questions, and then I will turn it over to some of my colleagues. There was an article this morning, I don't know if you saw this, in Governing. I guess you'll get that email. It's kind of relevant, though. And it was also, by the way, an editorial in today's Inquirer by John Longacre that everyone should read. He's the, I think, president of the Pennsylvania Restaurant Lodging Association. But the article this morning, I think, is very relevant. I'm just going to share some details of it and then go into some questions. It said that the central business districts of cities across the United States have been particularly hard hit by the virus. And the two main activity generators, office employment and the tourism, events, hospitality sector, have basically gone into what they're calling a deep freeze. That's clear in Philadelphia because 90% of our offices are unoccupied. Economist Richard Florida also suggested that central business districts could see a 20 to 30% hit on their employment base due to remote work. The shift towards remote work will reduce the level of city-suburb cohesion that comes from workers commuting from one place to the other. Suburban residents who are employed downtown have a real physical connection to the city. Keep in mind, it was our 41% of our residents in the suburbs, the suburban residents commute to jobs in the city. When they're in the city, they have a connection to the city by spending 40 hours a week working here. So if they're in the city, engaged in the city, and not being here, they hurt our whole hospitality sector. Less commuting to the office means less city-suburban engagement. The other piece they pointed out, which I found kind of interesting, is that one of the biggest concerns of the suburbanites is whether it's reality or perception, the feeling of being safe, safety. Nothing makes the suburbanites want to avoid coming into the city more than the perception again or reality of violent crime. Not only does increased urban crime reduce city-suburban cohesion by curtailing visits between them, but the apparent inability of some mayors to address it makes suburbanites less likely to view helping the city as a priority. I'm bringing these up because these factors suggest that the city-suburb cohesion will be under increased strain post-COVID, but sustaining that regional collaboration is really critical, especially to Philadelphia. The rise of remote work will make competition for talent in our city even more difficult. This will allow workers to live where they choose rather than where the jobs used to be physically located. In fact, there's some cities and towns across the country that are now called Zoom towns because people can go there and live and work remotely. Creating and sustaining this attractiveness is a regional challenge, I believe, for Philadelphia. So the question is, suburban and city leaders, we need to find a way together to connect a time when the new forces are pulling us apart. So my question, Jim, is what are we doing as a city to answer these issues and concerns of working with our suburbs and working together?
Sure. So I think you raised a number of issues there. There are, just to your last point around discussions with our suburban colleagues, I have a 3 times a week call with the county commissioners of surrounding counties where we discuss our response to the COVID-19 pandemic and our shared responsibility to guide our region through these difficult times. We work in collaboration. I'll let Dawn Somerville from the Commerce Department talk about our coordination with organizations like PIDC and the Center City District about how we respond to office-based businesses and their desire to either relocate some of their employees or downsize, or how we can otherwise support their continued operations in the city. And I think there was a long hearing earlier this week on Monday that discussed the city's shared responsibility to respond to our gun violence epidemic and our violence in general. And I think you heard some testimony from the police commissioner, from the district attorney, and other partners as to how we are attempting to respond to that crisis. But I'll let the Deputy Commerce Director talk about some of the specific engagement with those entities.
Thank you.
Good morning, Councilmember Dom and the rest of the council body. I'm Dawn Somerville, Deputy Commerce Director for Business Development here in the city of Philadelphia. As Jim Engler just mentioned, the Commerce Department continues our outreach efforts with our leadership and CEOs and C-suite. We are currently in the middle of implementing strategy to talk about what their needs are and what the retention efforts look like for the city. Whether or not the businesses will continue to work virtually, I am encouraged because of what we're now seeing with the vaccine that is now coming out. A lot of the feedback that we are getting from the business community is a wait and see. There's also a desire to come back into the offices to work. Although Zoom Land and Zoom City, Councilman Dom, as you mentioned, is reality, but people desire and need to be in situations where they can collaborate, talk, and brainstorm. So we will continue to partner with IDC, the rest of our chambers, the Greater Chamber, our minority chambers, continue our efforts to move again. I can tell you, as of earlier this week, I had a conversation with GSA. As you know, federal agency that controls a significant amount of employers in the central business core, over 30,000 employees. They control 6 million square feet of office space, own 3 million square feet. Our leadership at Commerce learned that they have secured multi-lease year.
Hey, the fax did not go through.
Okay.
Yeah, and I'm looking at it.
Derek, you're not on mute. Councilmember Green.
That's okay. Go ahead.
All right. Many of those leases have been signed for multi-year lease. Moving forward, I can also tell you the Commerce Department is in attraction efforts with new business looking to come into the city. Business is still happening, but to your point, Councilman Dom, we are in unprecedented time, challenging times with the pandemic. And in order for us to move forward, we have to be able to control the spread of the virus. But to let you know, we are working around strategy, outreach efforts are happening, and we look forward to what the future is for the city.
Thank you. I just have 2 quick comments for you, Dawn. One is the cost of opening a new business, which I said, I think a week or 2 ago in Councilman Derek Green's Finance Committee, is far greater than supporting an existing one. And the existing one's jobs have so many more jobs that our focus right now has to be on helping these existing businesses. It is crucial. And in the big picture, and I spoke to the new Commerce Director about this, we should put a lot of focus into the life sciences. That is the future 5, 10, 15, 20 years out for Philadelphia. And, we all like to hear good news. And last week we honored 2 of the doctors at the University of Penn who developed the ability for these drug companies to come up with a vaccine. That happened at Penn their development, okay, that allowed those drug companies, which is pretty amazing. And that was in cell therapy and other things they're doing. So, from an economic standpoint, I don't know if you're aware of this, but the economic job multiplier of cell therapy is like 5 to 1. So for every job we create in cell therapy, there's 5 more trickle down jobs, which is huge for the city. So I know we're all aware of that, but I just wanted to mention that. So thank you. Thank you for your testimony. Jim Engler, I'm sure my colleagues are going to have some questions. Before we move on, I do want to recognize Councilman David O. as being present.
Thank you very much, Chairman.
Thank you. And I have a couple of questions. First one's for Dr. Farley. Dr. Farley, first, thanks for everything you've done and your department's doing right now. This is unprecedented, and we all appreciate everything you're doing, and you're probably working 24 hours a day, 7 days a week, and just really appreciate everything you're doing. We're hearing a lot of information about contact tracing and our process for trying to understand where or how folks are contracting this virus. Can you maybe walk us through how you and your team are implementing a contact tracing program and how that information is being used to develop your thoughts around how this virus is spreading in our city or even around our city? And presumably you're using other research in the decision-making process. So tell us how all this data and information is being used to develop the public health guidelines and business restrictions they were currently under.
Yeah, thank you, Council Member. So our contact tracing system got in place around June of this year when case rates were, compared to now, very, very low. We were having between 100 and 200 cases per day. And the process for those people who are not familiar with it is when we hear of a case, we have a staff person call that person, find out who they might have a discussion with them to find out who they might have exposed. Therefore, who those contacts are who are high risk for themselves develop the infection, and then they try to find the phone numbers of those people who they might have exposed, refer to them as contacts. And then either that person or another staff person would call those contacts and say, you may have been exposed, and we would ask you to go into quarantine for 14 days. That we hired a large number of staff to do that. That process worked fairly well, but in late September, case rates started to rise very, very quickly here and around the country. This virus changed its behavior with the changing seasons as other respiratory viruses did. So now we're getting close to 1,000 cases a day. And so we do not have the staff to call even a minor fraction of those people. So we still do some calling for contact tracing, but for the most part, that contact tracing is not taking place just given the sheer numbers of people involved. As far as how we use that information, again, the primary purpose of this is to identify the contacts so that we can stop the chain of spread. The purpose for this is not, the primary purpose anyway, is not to try to understand how the person who is infected got infected. That would be a different sort of study, not an easy study to do. We do get qualitative information, anecdotal information from those interviews that gives us some indication for where that person might have been infected. For example, we'll say, who do you think you might have gotten this from? And often they'll say, well, I think I got it from a household member of mine who was sick 3 days earlier. That's the case, that's probably true. About half of the people, though, that we talk to have no idea where they got it from. And so it's a much more difficult steps are taken to figure out where a lot of people in Philadelphia are getting infected. So we do take that qualitative anecdotal information into account in trying to understand where the virus is spreading now. That's, for example, we do get lots of comments about social gatherings, and that's why we've had lots of communications around small social gatherings. But we also take into account studies that are done more by researchers and other people in other areas when we think about what sort of policies and restrictions we want to put in place to try to limit the spread of this. So, for example, the restaurants have been demonstrated through a number of studies to be very high-risk settings for spread, and it's not a surprise. Restaurants are where people get together close to each other without wearing masks, and that information comes from other sources. We do get anecdotes on that, but it's we use the other sources more, I would say, for our decision-making process around future policies.
Okay. I will say that there was a study from New York, just to put it on the table, that said that I think restaurant infections were 1.4%. I'm sure you're going to hear some of these statistics from the people testifying today. But let me ask you this other question, Dr. Farley. We've heard from folks in the hospitality work group. And when I say hospitality, again, I'm including arts and culture, restaurants, fitness centers, hotels. And some of them feel like they've been targeted and made to feel like the villains, while others feel like they don't have someone to talk with about the disparities in the rules. And I know you have a few small groups that you've talked with, but the business leaders here today that are in this session today are from restaurants, fitness centers, arts and culture, and hotel industries, and many haven't felt like they've had a seat at the table. I realize we're all upset at the virus, and oftentimes we're all face that anger, and we're trying to make the best decisions possible. We all understand that. But with the country's leadership, politics have played a role in managing this public health crisis. So when there are inconsistencies in the policies, of course, people are going to be upset and they're going to jump in. An example that came up yesterday is the difference between a fitness gym and a physical therapy gym. Fitness centers are considered unsafe for indoor operation, while physical therapy locations are considered safe. Both focus on the physical and even mental health of people. So why would we treat them differently? We may have an answer for that, but these businesses haven't heard it yet, and they're closing or in some cases just shutting their doors permanently. So I feel like we need to do a better job for them going forward. Can you talk about your ideas are for how we improve business relations for those hit hardest by this pandemic and these rules? And how do we have a better dialogue with them going forward? And I think the goal here is that everyone wants to operate safely. There are ways to do that, and I think you're going to hear those today. So I'm curious to hear what your thoughts are on trying to bring back this economy in a smart way, in a healthy way, adhering to the health guidelines, but not, we have some businesses, you're going to hear this today, they've been in business 30, 40 years. They're shutting their doors. They're closed. They've lost everything they've worked for 30, 40 years. And that is impactful. So share with us, how do you think we can improve this, and what can we do going forward?
First, let me say I am very sympathetic to the businesses that have been hit hard by this, and I do recognize that they've been hit hard by this. And I recognize that they've been hit hard by this through no fault of their own. They didn't invent the virus. They didn't invent the situation where these people, the virus tends to spread. It's just the nature of the virus. And I do recognize it's been very, very tough. What we in the health department have tried to do is limit the spread of the virus, to limit the number of people who die from it, while having a minimal impact on the economy. Minimal still could be a devastating impact for some quarters. So I know that's very tough, and individual businesses will say, it's not us. It's not, I did all these things, and I know there was no spread in my particular business. And most of them are maybe right in that. But that doesn't mean that entire sector is safe. We have to, the health department, go with the best evidence we have, and the best judgment we have about where we can limit the spread of that. Whatever policy we have, people who are just on the restricted side of the line can point to something that is just on the unrestricted side of the line and say, this doesn't seem right to me. So for the example you gave, I can understand why people would be upset about that. You can understand why health care facilities ought to be open, because if people are sick, then they need to be able to get health care. But gym facilities are risky, so it might make sense for them to not be open. So, is a physical therapy setting, is that really a health care, or is that a gym? That's one of those that's right just on one side of the line versus just the other. I can understand why people are upset, but you do have to understand that no matter where we draw the line, there are going to be people unhappy about exactly where that line is drawn. As far as how we engage in the future, I've gotten, as you might imagine, many emails from all sorts of quarters across the city, with their opinions and their suggestions. What I said is I'm happy to engage with these industries to talk about how we make things more safely. I, frankly, though, don't have the time to respond to each individual email, and I don't have the time to respond to each individual business. If we can come up with a structured way to have a conversation, I would participate in that. I would suggest that be organized through the Commerce Department, because they have the relationships, and that we're only one piece of that conversation. Financial support, I think, is extremely important. I am not an expert in the sort of financial support for these businesses and what can be done. So I need to have them involved in that. But so we are happy to engage with these groups as organized groups to see how we can proceed in a way that's as safe as possible while also supporting businesses economically as much as possible.
And if I could jump in quickly, Councilmember. So that organized engagement between the Commerce Department and the various sectors of businesses impacted by these latest restrictions is ongoing. It's been happening, to your point, about our meetings with several of the folks that are scheduled to testify today, as well as other impacted businesses. That engagement will be ongoing over the next several weeks, months, and years as we all try and recover safely and adequately from the impact of the virus. So that engagement has started. The new Commerce Director, Michael Rashid, has committed to that and committed to the business owners, again, who are represented on this meeting as well as in the meetings that we've had. So I would expect that that's going to continue over the long term.
Okay, thank you. So I guess, Dawn Somerville, you're going to coordinate these conversations with the businesses that have feel they don't have a seat at the table?
That's correct, Councilman Dom. As Jim Engler just mentioned, my Director Michael Rashid would like to have a restaurant advisory board set up that he will also be chairing along with other members of our department's team to talk about these issues as we move forward. We are aware that we just had an initial meeting with the gyms, I want to say a week ago. I'm sure that will take place as well as we continue to move forward.
Okay. Last night I actually read the 10 testimonies from all the fitness centers that were submitted. I read through each one of them. And I did not all of them gave me information, but 9 of the 10 did. And they claimed there were 16,200 visits to their collective gyms, 16,200 visits, 3 cases of coronavirus. Now, that's their statistics that they've shared with me. I have no way of verifying that, but that kind of information to me means that many of these people are probably practicing in a very safe way. And there might be bad actors. We all know there are always bad actors. But I think that also applies to the restaurants. I think most of the restaurants today are doing a phenomenal job. I was really proud of the efforts they did as far as health and safety standards. You're going to hear that today from them. But there might be, again, a few bad actors. And I guess we shouldn't just punish everyone for the small amount of bad actors. And that's really something that I want to make sure we don't do. Let me go to the next question. It's for someone from Otis, this question. And it's through the implementation of outdoor dining, we've seen, and you're going to hear today, some issues of enforcement differences. And we've talked a bit about this with everyone as they've come up, but in some cases, there's tickets or citations that were issued, and in other cases, businesses were given warnings. Can you give us some information about how you're working to enforce consistently or explain when variations make sense? I see Mike Carroll. Good morning.
Good morning, Councilman.
And by the way, Mr. Carroll, let me just say this. Thank you for everything you're doing. You've been extremely cooperative, and we appreciate everything you're doing. So thank you.
Thank you very much. Thank you. This is, again, Mike Carroll, Deputy Managing Director for Office of Transportation, Infrastructure, and Sustainability. I think that, people's perceptions about the enforcement are somewhat informed by the fact that we are stretched in many respects. We're trying to coordinate as best as possible, not just within departments, but across departments. So streets, license inspection, health department are all involved in some form of enforcement of different sets of rules, which each is sort of assigned and authorized by code to address individually. But when it comes to the question of getting warnings or, getting citations, for the most part, what we're trying to encourage the inspectors to do is to work with people to rectify situations. And even if, there's a notice of violation, the intention is not to, punish someone, but to kind of reinforce the message and then identify the corrective action. So often what happens is that the warning is coming first. And it's only after a warning or a conversation, which may be with staff and not even the manager, it's sort of happening in the field. That second visit or third visit is resulting in some form of citation, and sometimes that's contributing to what appears to be disparities. There is another dimension to this that I want to recognize as well, and we just did some analysis on this question, and it has to do with the geographies of where enforcements are taking place. And I think there's some perceptions people have in outlying neighborhoods that certain areas are being targeted more so than other areas where it appears, at least from a distance, that there's more more leniency, or there's sort of like a lack of attention to situations. When we took a look at this and we sort of mapped things out, it seems like that disparity is more a function of where the activity is. So, if you have one location which is far out from, let's say, Center City, and it's really the only operation that's going on out there, and we do find a violation in that location and we do cite them, it's sort of like we hit 100%. We hit 100% of the operations in that neighborhood, and it could just be one or two. Whereas, we've seen, there's clusters of restaurants, there's sort of corridors that are set up in Center City, and we may find, 5 or 6 of those get cited, but because it's sort of diluted by other actors who are not necessarily involved in the same issues, and sometimes, there's a little less noise that gets made, maybe. At the end of the day, it gives that appearance, but so far we have not seen, we'll keep looking, but we have not seen systematic disparities in terms of the geography of where enforcement is taking place. But having said all that, I do want to recognize the system is still somewhat imperfect. We're placing a pretty heavy burden on individual inspectors to use their best discretion to figure out how to address situations. We've tried to reflect on what we've learned, and we'll continue to do so and try to improve the guidance we give inspectors and take all the feedback we can get, and again, do the best we can to make sure we're as even-handed, and we're kind of keeping the main purpose in mind, which is to keep people safe and not to punish businesses.
Thank you, and I appreciate that. It sounds to me like you're trying to use more honey than vinegar here, so that's always a good thing, because these businesses basically are, they're really struggling. Let me just pass this. I'm going to have another question for Dr. Farley, but before I get to that question, I just want to share with you the employment numbers in the country right now. I think what hasn't missed a beat are the employment numbers for the legal world, for the construction world, finance, and insurance. Their employment numbers are the same as last year. But what has been affected the most is the group of people basically in this hearing today, the hospitality industry, whether it's restaurants, fitness, hotels. Hotels are off 50 to 75%. Restaurants are off over 50% at this point with this latest shutdown. Fitness centers are basically shut down. Those are the areas that are really getting crushed. So looking at this and saying, I see that sun coming up, and that's the vaccine. So Dr. Farley, we have a vaccine that's being released throughout the country, and it sounds like it'll be a slow release. Can you give us an idea what we can expect over the next few weeks? And give us the program. Like in the next month, how many Philadelphians do you think we could get vaccinated in the next 2 months, the next 3 months, the next 6 months? If you can, and you may not know this yet, give us some sort of a pathway, because right now, this is our hope. This is where we hang our hat on, because we have to get out of this pandemic.
First, I agree with you that the vaccine is really a game changer here. It's going to make a huge difference, and I'm very excited about its arrival. I really wish I could give you a schedule about how many doses we're going to get per week or per month, and then at what point we will have vaccinated enough people to say the virus is no longer a problem. But we just don't have that information. Even yesterday at the press conference, I quoted a number that we were scheduled to get 27,000 doses of the Moderna vaccine next week. This morning we was told maybe it won't be that amount. So it's very unpredictable how many doses we're going to get each week. I can only say it's going to be months before we have a lot of the city vaccinated, just because of the rate they're producing it. It'll be faster if there are more vaccines that are approved by the FDA. There are more vaccines that are in the final phase of trials. Overall, I can say things are going to start getting better in January, and I think they should continue to get better for not just because of the vaccine, but also because this is a respiratory virus that's behaving like other respiratory viruses. They tend to be at their worst in January and get better from there. And so we're going to have two things operating in our favor after January. I can't tell you when, though, it's going to be, hit the peak. Maybe we've already hit the peak, or maybe the peak is going to be a month from now. It's going to definitely be getting better in 2021, and I just wish I could give you better timing.
Well, thank you. Look, and if there's anything this legislative body can do to help you in that area, I know every one of my colleagues and I would give you 110%, because this is the hope, especially for this hospitality industry. We need that vaccine desperately to come into Philadelphia. So I want to recognize Council Member, our Vice Chair, Brian O'Neill, who's joined us. Good morning, Council Member O'Neill. And I know we have several questions, and I want to start with Council Member Curtis Jones.
Thank you, Chairman, and I appreciate you staying focused on the small business community, which are the driver for employment in neighborhoods and taxes for the city of Philadelphia to provide services. So thank you for this hearing. The first thing I want to do is acknowledge some of the efforts of the Commerce Department, Health Department, Streets Department, L&I. Most recently, Chairman, they did a walking tour on Main Street in Manayunk. And that was helpful in regard to, encouraging the businesses there to hang in there, to power through, push through this pandemic. And one of the things that I appreciated about the walking tour with the new Commerce Director, Michael Rashid, was that they promised not to do harm. The government comes up sometimes and says, hey, I'm the government, we're here to help you. As we cite you, tax you, shut you down. That was not the purpose of the tour, and they observed, they took notes, they made inquiries, they offered instructive comments on how to do that. But the purpose also was to look at outdoor dining, which has been one of the saving graces of Main Street and many other commercial corridors around the city, and to create, Mr. Chairman, uniformity, predictability about what is acceptable and what is not in our thoroughfares, roadways, walkways throughout the city. Many of these small businesses are investing limited capital that they still have. And if we're going to be open 1 week, shut down 1 week, at least if we continue to have outdoor dining, structural improvements where they can place them, and that predictability is essential to their survival, because many of them are going to opt to not open, not to continue to fight, and wait until hopefully this pandemic passes over. So with that constructive comment to the departments, Mr. Engler, thank you for allowing those departments to come up there, and hopefully, God willing, they will make more tours like that to give instructions to merchants, to give hope to those same merchants. One of the things that I ask is a lot of the hotels, I have several in my district, have been hit hardest as well because of the lack of tourism. But what do you think of the conversion of some hotel rooms into day offices, where if you cannot work from home all the time, maybe interrupted by our lovely children, or can't present the kind of Wi-Fi and meeting space that you need, have you worked with the hotel industry about the possibility of temporary and maybe even permanent conversion of shared hotel space, shared meeting space?
So I'll defer to the Deputy Commerce Director to answer that specifically. I think we're open to any and all innovative ideas on how to reuse vacant space, whether that's vacant office space or vacant hotel space, but I'll defer to Dawn for any specific conversations.
Thank you. Good morning, Councilman Jones. How are you?
I'm fine.
The name escapes me right now, but I will get the name back to you. There was an introduction made to the Pennsylvania Restaurant Lodging Association of a individual company, a startup company who started in Atlanta, and I also believe they've done some things in Texas as well, as they created space similar to what you're speaking of, that it was a conversion if you were tired of working at home because of your partner or whatever the circumstances were, you were set up to go work in a hotel space. Basically, you would it would be a assigned space. You would operate in that space during the day, and the hotel, according to how many people signed up, would bring staff in, and you were able to have lunch or dinner or set up meetings and Zoom meetings from that location. There has not been a broader conversation with the hotel association regarding this, but it is something that should be entertained and thought about. But I will get you the name of the company that we initially spoke to because they wanted introductions into the Philadelphia market to do just that.
Well, I think when we look at shared space, what's the one down by the Clothespin building? There is on a third or so floor, there is a shared space operation that works well. And a hotel is uniquely set up to be able to convert to that in a short amount of time. So something that I would like to see promoted to host hotel space. Is there thought given, and I know there's a difficult balancing act between tax amnesty and keeping the services moving in the city of Philadelphia, but U&O taxes and things like that, where there's been a seismic shift in both restaurants, commercial spaces, that they really aren't using them. Is there a formula amnesty program being developed to be a one time only lifeline for some of these businesses?
Yes, Councilman. So we announced some changes to the application of use and occupancy taxes for impacted businesses, specifically restaurants. I'll let the finance director talk about that in detail.
Yep. So we announced a couple of weeks ago that we would allow restaurants to essentially omit from their calculation of the space they're using their indoor space, because we were saying that couldn't be used. So we set that up just for this period, and that is in place through January 1st, when the restrictions are scheduled to end. And then we'll have to re-examine that if the restrictions are extended.
Finally, is there going to be, God willing, the Biden administration will send some relief not only to individuals that are struggling, but to businesses. Minority, and I want to thank again PIDC and Commerce Department for working diligently, not just downtown, but in neighborhoods and commercial corridors to assist. But there needs to be some focus given to insurances in the city of Philadelphia, in urban areas, in high impact areas, and quite frankly, risky areas. And what we found was a lot of people couldn't take advantage of it because they were underinsured and they took the bare minimum insurance, and there were covenants in those policies that did not include pandemics, did not include social unrest, and businesses that were interrupted by them, by those two things. So the insurance industry makes a lot of money in the city of Philadelphia in spite of its risk, and there should be a pooled risk assignment, especially for small inner city businesses, in light of all they went through in 2020, to give them some type of technical assistance about what type of insurance that will cover these kinds of things, but also to lower their premium payments because we haven't seen the worst of the wave of financial problems that some of these businesses are going to have when they get their new premiums in order to be able to operate in the city of Philadelphia. So I'd like to get ahead of that curve to make sure that someone advocating on behalf of small businesses in the city of Philadelphia does just that.
Thank you, Councilman. I'll defer to again to Dawn if there's been any ongoing discussions with the Commerce Department with that. But I think, again, from the administration's overall perspective, we're happy to work with businesses, work with the State Insurance Department, the General Assembly if there needs to be legislative changes as well.
No, and I'm in agreement with Engler. There is the need for a broader conversation around that, Councilman Member Jones. As Commerce Department is working, we have heard about those horror stories, basically to speak, primarily in some of our inner neighborhoods, not in the central business core, where the insurance that was in place, either they didn't read the fine print or the information wasn't communicated to them what was going to be covered and what wasn't. That is an ongoing discussion as well internally as how we make sure that our small businesses are building to a capacity and understanding financial responsibility as it relates to their operations, as it relates to a crisis. And many of our businesses were just a crisis away. And here we are in a pandemic and understanding that some of them will not survive. So yes, these are all things that are in discussion and for consideration.
Finally, Mr. Chairman, during the uprisings and civil unrest, some of the peaceful protests turned into looting. And I would like to encourage the city of Philadelphia, particularly the Commerce Department, to come up with an early warning system, almost like an Amber Alert in respect to a protest of sizable nature. You know, when the sun goes down that you can predict certain problems. But are we working with business associations, mall owners and managers to say, all right, you need to not only expect us to help you, but you also need to help yourselves by maybe bringing on private security personnel to guard your shop. And if we were to do that in a collective way, we could set up almost like a fire drill around the city so that the devastation of looting doesn't further set us back. Is there any consideration for that?
Through the civil unrest that occurred throughout this time with the pandemic and the civil unrest, the Office of Business Services, led by Nazir Sabri, was in coordination with the Office of Emergency Management, as well as other offices, as well as Stacey Irving, with the police department. So there were several interagencies that were collaborating and watching out also for social media. There were disruptions that occurred that we didn't anticipate for. And I would say you're correct. So again, the coordination was in place, but understanding where the disruptions or where the looting and tracking that has to do with keeping your ears to the ground, has to do with monitoring social media, which a lot of the collaboration happened there. And some of it didn't happen on social media platforms. But to answer your question, we did speak to managers that took care of different places, City Line Avenue, Baker Square. We were in coordination and conversations with them. Those that were able and could afford had already placed Franklin Mills. I know that they had security in place. So they welcomed the opportunity to also have the National Guard and the alerts that we were able to provide them as a heads up. And we continue to do that on an ongoing basis now.
So thanks to Ms. Sabri, we were able to, in some of our corridors, minimize some of the looting. We couldn't stop it all, but we were able to minimize. But I also want us to looking forward thinking to set up that early alert system, because coordinating with the police and private security, we were able to minimize it in certain areas where people pulled up, looked, saw it was covered, and moved on to the next commercial corridor. But I would encourage that to be a citywide program. Thank you, Mr. Chairman.
Thank you, Councilmember Jones. Great questions. I just want a little follow-up on your questions, and they were really good. The Revenue Commissioner, Commissioner Breslin, has been extremely receptive. We've met with him several times since September. They have programs for businesses. I just want everyone to be aware where they can help them with some of their tax issues and work out deferments. So I want to thank the Revenue Commissioner and his department for working with all the businesses. They've really been really good. So thank you. And let's see. Next questions, I guess, would be from Councilmember Catherine Gilmore Richardson.
Thank you so much, Mr. Chair. I truly appreciate this resolution and the hearings as we continue to work through the devastating economic impact of COVID-19 on our city, and particularly with our restaurant, hospitality, and business community, which in turn affects a number of Philadelphians who are employed in these industries. So I wanted to start off with a thank you to the Department of Health and Dr. Farley and his team, and especially the Commerce Department for the COVID-19 Small Business Relief Fund, and all of our city partners who have been working so diligently to try to provide relief to business owners at this time. I wanted to circle back quickly to Dr. Farley with a question around contact tracing. You said in June that 100 to 200 cases, when we were at 100 to 200 cases per day, that staff members were reaching out to individuals who had presumptive positive cases of COVID. Now that we're at 1,000, are we still contacting 100 to 200 people per day around contact tracing?
It's about that many. Yeah, we're still doing some number like that, which ends up being a small fraction of the total people who are diagnosed.
Okay, and you said from that information, the 100 to 200 individuals who were contacted, we can't properly ascertain, even from that small sample, where a majority of the presumptive positive cases are coming from in the city?
That's correct.
Okay. And then I wanted to shift to another question for Commerce relative to historically disadvantaged businesses. I heard our Deputy Mayor Engler talk about working with business owners, but particularly historically disadvantaged business owners. And I've heard from several of them, some prominent who particularly are in the restaurant industry, are in danger of closing their locations. Some who have already closed, and some of them have told me that for whatever reason they may have had an issue with the city from, a revenue perspective, needing to get into a payment plan, et cetera. But because of that, they were unable to qualify for any of the funding offered to the city. And I'm talking about restaurants and businesses that are internationally acclaimed, that are a part of our promotion and marketing materials for the city. So how are we helping those businesses, sort of get into compliance so that they can be eligible for whatever funding may be forthcoming?
Thank you for that question. Councilmember Richardson, I know early on when the Commerce Department was able to put the small business relief money to the street and the onslaught of COVID and pandemic, we worked very closely with the Revenue Department and other departments to get these businesses into a compliance or payment plan. Once we received, and when I say get them, we had someone that was assigned to working directly with them and with the Revenue Department to get payment plans initiated, or the agreement, let me say the agreement of a payment plan. Once we got a sign off from the Revenue Department, those folks went through and were able to receive funding from the city. If there were cases that were more complicated or were not able to get funding, the Commerce Department, the Office of Business Services, works with those businesses to get them compliant and then to an agreement that you know of. We'll be happy to look into that immediately as we begin to think through the next phase of funding to hit the streets.
Okay, thank you for that response. I also wanted to know if you all are still working on capacity building for some of these organizations who really lack the internal structure to adequately participate in the application process.
Yes, that work is happening through the Office of Neighborhood Economic Development under Deputy Commerce Director Karen Fagley, and as well as the Office of Economic Opportunity with Iola Harper. So we are working with businesses to build capacity and to see where the areas are of, so to speak, weakness, where we can strengthen them to prepare them for opportunities in the future.
Okay, thank you very, very much. And my next question is for our finance team. For the record, I just wanted to know how we are continuing to look at our current tax structure in our city relative to our heavy reliance on the wage tax in light of the new work from home opportunities that a number of companies have offered as a result of the pandemic. What type of collaboration is happening with our state partners and others to continue to figure out how we really look at our tax structure in a significant way so that we don't have an over-reliance on the wage tax?
Yeah, and that's a really important question that we are talking about as we prepare for the FY22 budget process. And we're at the stage where we're talking about it internally and whether there are things we need to do. And once we've determined that, I think then we'll start to reach out and work collaboratively with our partners in the state.
Okay. Thank you very much for that response. And thank you so much, Mr. Chair.
Thank you, Councilmember Gilmore Richardson. I just want to follow up on that question, Rob. 41% of the residents of this, 41% of the workers in the city live in the suburbs. What do you anticipate of that 41% will be lost wage tax? What percentage?
So we built that into our initial projections, and we assumed that there would be a two-part fall-off, one that would be immediate and then a long-term fall-off. I have to actually get back to you with the exact amount, but we did build in an assumption that there'd be a permanent hit to our wage tax because there are people who would never come back.
Right. Okay. Thank you. Thank you very much. I'd like to also recognize Councilmember Maria Quinones Sanchez as being present. Good morning. And now I know that Councilmember Derek Green has some questions. I'd like to recognize Councilmember Derek Green.
Thank you, Mr. Chair. I want to thank the administration, the health department, and all the city departments in reference to the work you have done, the yeoman work that you have done in reference to addressing this pandemic. This has been unprecedented in the way it's impacted every aspect of the world and the steps that you have taken to try to prevent the spread. And the sense of urgency that you have used to address this global pandemic is commendable. But this pandemic has also been an economic crisis. And my questions focus on, I don't get the same perspective of that same level of urgency in reference to the economic crisis, in reference to the small businesses that have been impacted, as our chair said, and I agree with him, due to no fault of their own, have been impacted by this pandemic. In particular, as I think about some of the steps that have been taken and the measures, I'm just concerned in reference to how we continue to move forward and demonstrate a greater sense of urgency to address small businesses. In particular, I know a number of the neighborhood improvement districts were pushing the administration to open up outdoor dining. I know from my work and talk with a number of those districts, and also through my work with National Cities and other organizations, I saw what other cities were doing to more readily open up outdoor dining for businesses, because time is money, and we all know that Philadelphia is in the Northeast, and so we knew that we were going to have a finite amount of time to provide outdoor dining. And each week that we lost in doing that, that was another week that a number of the businesses that have been really significantly impacted by this pandemic did not have the opportunity to at least try to convert some of their operations to an outdoor dining. So I say that from this perspective. When the new measures were introduced, and we all have seen the increase in the spread, not only here in the city of Philadelphia, but across the nation. But then it was a period after that the relief measures on the use of occupancy were announced. And I think this goes to that lack of coordination and communication. And I know that Dr. Farley, you stated that you're open to talk with groups about this issue. And I know the Commerce Department has been doing that throughout this pandemic. I've worked very closely with them on the PHL Small Business Grant Loan and Relief Fund. I guess my question is that going forward, these new measures are into effect until January 1. I'm sure prior to that time period, there will be some steps to decide whether to extend it or to pull back on those measures. So in this regard, is there going to be a coordination, not just Commerce Department, because the Commerce Department has been doing that. They've been reaching out and having conversations, but it's not a silo approach. We need to have a more combined approach, which is the Commerce Department, the Mayor's Office, and the Health Department in a collaborative perspective in reference to how we're going to communicate to those businesses that are going to be testifying here today about what's going to happen after January 1.
Sure. Thanks, Councilperson. So we have asked the Commerce Department to convene those groups so that we can get feedback from them to figure out what are the levers that we might be able to pull in order to impact their businesses and to support them. If there's going to need to be, restrictions that are extended past January 1st or January 4th in the governor's order. I think going back to the November, when we imposed the restrictions in November, I think we tried to move quickly, probably not quickly enough for a number of businesses that were concerned about how these would impact them and how the measures that we did put in place, whether it was use and occupancy or business income or receipts tax, were not strong enough. I think we are working with the resources we have, with the levers that we can pull to support businesses. But we have said from the beginning that we're not going to be able to make it through this pandemic without substantial support from the federal and state government. The state General Assembly decided to take over $1 billion in CARES Act money and use it to plug their budget hole instead of supporting either local governments or supporting small businesses. I think that was an unfortunate decision, but has put us in a position where our resources are limited. And while we advocate for additional federal relief, there's an opportunity that things may move this week. That money may flow through previous formulas that we know have not supported our local businesses. That's why we've argued for substantial support for state and local governments where we know we can get the dollars through to businesses who need it most. And it looks like the Republicans may decide to block that. So, we continue to lobby there. Appreciate your support, appreciate Councilmember Dom's support in organizing those lobbying efforts with our partners at the federal level. And we will do all we can to present a coordinated approach to any additional restrictions and any additional relief measures. And we're just trying to do it in the best and fastest way we can as a large government.
And I appreciate that. And, through, my membership on the board of National Cities, I've been pushing cities are essential. Every time I get information from NLC, it could be 11:30 at night, I'm sending that information to the administration about what I'm hearing. I do agree with you that it seems like the bipartisan package that is moving through the federal government more likely than not, unfortunately, will not include state and local aid, from what I've been hearing in the past number of hours. But that's a separate perspective, and I agree with a lot of those points. My question is, and I'm going to come back to this, I know you're asking the Commerce Department to convene those conversations, but the city of Philadelphia is not a silo. It's not just the Commerce Department. A lot of the decisions that are being made by the Health Department. And so, and also in coordination with the mayor's office. So the question is, when you're having these conversations, and Dr. Farley said he won't participate, all these conversations are going to be convened with the engagement of and participation. We want those infections to go down, but that's the engagement that people are looking for. They're looking for that engagement, not just with commerce, but with the mayor's office as well as the health department. So will both other departments be willing to be part of those engaged conversations with some of the organizations and groups that are represented here today?
Yes, those are there's that commitment that has been made in the meetings that we've had, again, with some of the representatives that will testify today and their industries. And we will do that as well. The health department, the mayor's office, and other city departments involved and necessary to those conversations will participate in those convenings.
Okay. I'm clearly familiar with the challenge that the city has from a fiscal perspective, and I know our fund balance is abysmally low at this point. And if there's some measure of hope that there is some additional state and local aid, it seemed like it may not come out of this bill package that is moving through Congress this week. And then from my information that the president-elect is also looking to do another package going forward, hopefully in the first or second quarter of 2021. My question is how we're going to use some of those dollars, and this goes back to that urgency for economic development and promotion, especially for these industries and these segments and these small businesses that have been so fundamental for the growth of the city. When you think about where we were in the early 90s in reference to our center city core and where we are now from both convention and visitors, from hospitality and restaurants, from arts and culture, we've gone a significant long way, which has helped to provide additional dollars into our city. Our budget, this year pre-pandemic was over $5 billion. So my question is, will there be a commitment to spend more dollars than we have done? And I do want to thank the administration for putting some additional dollars into helping the initiative that Governor Wolf has with Senator Hughes' support that helps small businesses that did not get that payroll protection program dollars. But when I look at what other counties did, when I look at what Montgomery County did, when I look at Allegheny County, they put more of their CRF or coronavirus relief funds into those initiatives. Just last Monday, or on Monday before last, during the Bills versus 49ers game, Baltimore had a commercial about promoting Baltimore and asking people to come to Baltimore to enjoy and spend their dollars there. Are we going to have that same type of commitment going to 2021 if there are additional dollars that come to the city of Philadelphia? And not just a small amount, but a real sense of urgency that we've really got to promote our economic development and our hospitality and these industries and these businesses in order to move our city forward to try to at least get back to where we were before.
Sure. So it's hard to make a commitment because we don't know the size of the stimulus package as well as the restrictions. As you know, the coronavirus relief fund dollars that we received come with significant restrictions that the finance director can speak to. The other...
Mr. Engler, if I could just say in all due respect, yes, they do come with restrictions, and I'm very familiar with a lot of those restrictions, but a number of other entities like Baltimore, Bucks County is using their CRF dollars to do marketing of Bucks County right now. A lot of other entities are doing this. And I had conversations with various agencies within the administration about these ideas in the summertime. And I understand that we were trying to focus on, relief for hospitality and some of the other initiatives that we have provided dollars for. And I commend the administration for doing that. I'm just saying going forward into the next year, there should be a greater commitment in that regard.
Understood. And I talk regularly again with the county commissioners, their allocation of their CARES Act dollars. The situation in the counties is substantially different. They're not dealing with the same level of municipal expenses that we are. And in the case of Baltimore, both Baltimore County and Baltimore City were able to receive separate CARES Act allocations in addition to what Maryland received and how Maryland decided to dole out those dollars. I think you have our commitment to continue to support businesses that are impacted by COVID and industries that are impacted by COVID, specifically the hospitality industry. When we reach mass vaccination levels that Dr. Farley has talked about, and there are, ease of travel, and we are seeing the return of our hospitality sector in a big way, it's going to require additional support from the city government, from the state government, and from all of our partners. So you have our commitment to that. I can't, again, speak to specific allocations based off of what we expect to see in a relief package and what restrictions come with those new dollars. But we are committed to supporting these industries and sectors as we move forward, and to do it collaboratively with City Council.
And I do appreciate that. We do a number of expenses that a lot of other jurisdictions do not have, based on our high level of poverty. The fact that we are a city and a county, I would agree with you. We get shortchanged, whereas we should be getting. Even the funding formula I saw for this possible $160 billion showed an allocation for states, counties, and cities. And because Philadelphia is both a city and a county, we're probably not going to get the full range of dollars that we should get, and that's very unfortunate. And I also think we should be putting more pressure on the Wolf administration to provide more dollars, because as our center city core goes, that's how the city goes. As our city goes, that's how the region, and as the region goes, there goes the Commonwealth of Pennsylvania. And so that's very important that we should be getting those additional dollars that we need. And I'm glad we do have some new leaders in the General Assembly that can help push that, but we're going to need to push that even more because it's important. The last question I had is, and I know the challenges of trying to navigate this budget has been very precarious. You mentioned the fund balance, which is very concerning. A number of the other pressures we have in reference to our labor contracts in the school district, other things that will be coming up as part of not only this calendar year as we manage our cash flow until we get to the new fiscal year, which starts on July 1. Are there non-financial means that we could use to help better promote the region? Going to some of our corporate partners who may have marketing dollars or reserve cable or television dollars. And when I think about the work that we did collectively as a city in reference to Philadelphia Delivers in responding to the Amazon proposal, can we have that same type of energy in reaching out to a number of different entities who can help us promote these industries, hospitality, and other means that are done in non-financial ways, where we can bring others to do that? Because we're really in a situation that is very concerning. When I think of where we were in the early 90s, when the city was on the verge of bankruptcy, but other cities and the counties around us and the Commonwealth were not really in that same financial situation. And it was really more Philadelphia. We're in a different dynamic where all cities are in a very precarious situation in reference to trying to get back to what some would say is normal. And so they're competing. I'm already seeing advertisements and discussions about how to get people that live in the Philadelphia region to go to this city or that city for hospitality and tourism. So from the perspective of using non-financial means, I'm going to say non-financial to the city because we're in a very challenging perspective, but reaching out to various entities to help us to promote Philadelphia, the region, our economy, and use that same sense of urgency that we've been using to really spread and wear a mask and do things that we need to do in reference to the infection rates in the city, but using that cooperative collective spirit that we used in reference to the Philadelphia Delivers and the Amazon proposal.
Sure, and I'll turn it over to Dawn to speak specifically about some of that engagement. We have had that engagement with our Greater Philadelphia Chamber of Commerce and our business partners there, so I'll turn it over to Dawn.
Thank you. Councilman Green, as discussed, and you know some of this, you've been included in some of these conversations. There have been discussions with the Chamber in collaboration of efforts of the 4R framework, reimagine, restart, reopen. So those conversations are happening and moving forward as well. To the side of that, with the new Director of Commerce in place, Director Rashid has begun to have conversations as well with different corporations and entities about Philadelphia and the presence, our presence here in the market. And as she spoke to, of the region, Philadelphia is a major contributor of work, employees, businesses that all want to operate within our region, within our core. We've also did outreach to several other corporations to speak to them about just that. How do we continue to promote the city without a non-financial commitment? There are also corporations, as our budgets have been strained, corporations have cut in their budgets as well. Just recently, Councilman Don spoke earlier about life science. We thought about how we continue to promote Philadelphia for life science for attraction efforts. And as of yesterday, with Select and in partnership with PIDC and the City of Philadelphia, we conducted a virtual site tour of the City of Philadelphia for life science business. These are the type of initiatives and efforts that we are doing to keep Philadelphia up front, to keep our name there, that we are open for business and to continue to promote the city. But the efforts are going to have to be collectively, not just for us here in the city, but working through the region for all of us to continue to strengthen our position in the market for those efforts. So that work is being done. It will continue to go on, not just for this year, but for the next several years as we look to rebuild the region to our, well, beyond former years, to strengthen our region moving forward.
Okay. Well, thank you for those comments. I just want to just reiterate that we need that same level of urgency that we've shown to keep Philadelphians safe from the virus, and also trying to keep Philadelphians employed and maintaining and growing our small businesses. Thank you, Mr. Chair.
Thank you, Councilmember Green, and thank you for your questions. Very good. I want to recognize Councilmember Isaiah Thomas, who's joined us. Good morning, Councilmember Thomas. I also want to mention, I'm sure that Jeff Orsino from Visit Philly is going to mention this, but some good news is that Philadelphia was named by Condé Nast Traveler, I think, as one of the top 8 places to visit in 2021. So that's a positive. We just want to make sure things are open for people to visit. And to follow up on Councilmember Green's comment, in 14 days, many of the people testifying today are wondering what rules are they going to have to operate their business under. They have no idea. And I think one of the issues for them is that we can't just give them 2, 3, 4, or 5 days notice on rules. We have to give them advance notice, and that's that sense of urgency. And I think, I'm listening to the commentary. The city doesn't have enough money to support all these different problems and businesses. We just can't afford it. So I really think, and you're going to hear from more testimony and my colleagues, we have to start focusing on how do we reopen in a safe way, a smart restart? How do we open those gyms in a safe way? How do we get back the restaurants in a safe way? And I think if we hear from the fitness people, gym people, the restaurant people, hotel people, they'll tell you how they could do it in a safe way. And I think we really need to listen to them and do it, because otherwise we will destroy this economy. I'd like to call upon Councilmember Cindy Bass next. I know she has some questions and she's been very patient. Councilmember Bass.
Good. Is it still morning? Good morning. So I want to thank everybody. Thank you, Mr. Chairman, for conducting this very important hearing. As you mentioned earlier in your comments, we have been having conversations with the restaurant industry and the hospitality industry about some of the challenges they face. And I can only imagine how difficult it must be. I mean, we did an event. I did an event on Saturday, and, we had it all planned out. It was going to be outdoors. And when the governor's new rules came down, we had 2 days to sort of scramble. And so it really did give me a taste of what it's like to try to, quickly change up and go in a different direction. And so I had a whole line of questions prepared Just thinking along those lines. But I got a call this morning, and I'm going to switch up just a little bit. I got a call this morning that Ray Murphy, who many know, I know he knows Councilman Curtis Jones very well, passed away. Ray Murphy was a titan in North Philadelphia in the business community on North 22nd Street and beyond North 22nd. He wasn't just limited to that area. He was someone who knew the pulse of the neighborhood and also owned and ran several businesses, including Tommy's Men's and Boys Wear, which was a staple in the community for decades and still is. And so we lost him to COVID. And, it's just really hard as we, prepare for, a vaccine that's getting ready to be distributed and high hopes and hopes for a brighter tomorrow. It's really hard when you lose someone who's just such a wonderful person as you get down almost to the finish line. And so one of the things that I wanted to do is talk this morning with the administration about enforcement, because one of the things that I'm seeing is, within the African American community is the spread of COVID. I'm seeing some corner stores where it's almost as if there is no pandemic going on. And we need enforcement in our neighborhoods. We need enforcement, not just in Center City, but in a lot of our neighborhoods, a lot of our corner stores, the takeout restaurants. Folks are still going, still packed in. And I'd like to hear from the administration, how do we get the enforcement from the health department? How do we get enforcement from L&I and from, the administration to make sure that anyone who is operating in a manner which puts other people at risk, because you don't just, put other businesses at risk. Some of this behavior has really shut down the activity in Center City. There's a ripple effect to all of this. And so it's caused COVID to spread. It's caused a large number of infections here in the city of Philadelphia. And so if we don't, pinpoint areas where we know that people might not be playing by the rules, why not target in on those businesses first? Why not make sure that we get down to the businesses that we know, that they're not following the rules? And I can give you a list. If you don't know, I can let you know. I think every district council member can probably give you a list of areas that you can go to and find lots of people congregating without masks, without social distancing, not doing any of the things we recommend. And as a result, again, there's a ripple effect. And so businesses are closed, people are out of work, and as you know, within the minority community, when everyone else is hurting, we're dying, okay? So what can we do around the enforcement that we all know we need to do to be able to help businesses function, operate, get back on their feet? But we've got a few bad players that need to be addressed.
So thank you, Councilmember, for that. I'll turn it over to Dr. Farley to talk about some of the health department's specific enforcement. Health department has inspectors out across the city visiting those businesses. Obviously, your offer to share a list of businesses, I think, would be appreciated, so we can, again, target those efforts to the most serious offenders. I think we are trying to balance being supportive of businesses, to Councilman Jones's previous point, supportive of businesses operating safely and correctly, and not over enforcing against businesses that may just not understand the rules or may not just be interpreting them in the right way. But I'll turn it over to Dr. Farley to talk through what the health department has done so far.
Yeah, thank you, Council Member. So we do have inspectors that, for the most part, under ordinary circumstances, they inspect restaurants. And they're out there, they're still inspecting, they inspect restaurants and food stores. They're still out there doing them on a schedule, but then they're also available on complaint. So any complaint that comes into 311 or any complaint you want to send to me, we will send to our inspectors. We'd be more than happy to send them out. And if it is, as Jim Engler just said, if it looks like they're just being a little lax and need a little warning, then they get that. On the other hand, if this is really something that is, they're defying what the rules are, then we will shut them down. And we have shut down a number of businesses in the city. We'll continue to do that. There is a problem, though, that there's a lot of businesses in the city, and there's probably more out there who are not following the rules then we have inspectors to get to. So it's always going to be, we'll follow up on all of them. We're not going to be able to follow up on all, be there every day when people are defying us.
Well, and I understand that, and that's part of my concern, because I know you're not going to be able to be there all day, but if you're going to shut down an entire industry, then if we're telling you that this location is a problem, then they need to be shut down too, because they're causing the ripple effect that I'm speaking of. I don't think it should be a warning. I think if you go out and you observe 20 guys standing close together, in a 10-foot space, and nobody's wearing a mask, nobody's social distancing, then this location is a breeder. This is a place where this virus is, allowed to flourish. And so the idea of waiting for health or L&I or whoever to come back out, I think, is unacceptable. I just, we wait and we wait and we wait for enforcement. We need enforcement now, especially because of the dire consequences to health and to the city's finances and to the industry itself. We need more action immediately. That's not going to be, well, we're going to give you a warning and then we might or might not get back to you. And meanwhile, it just keeps going on and on and on.
Appreciate that. And there definitely have been a number of places that we have shut down, and we'll continue to. But I take that suggestion. Thank you.
Okay, well, I hope you'll take it and act on it. So, thank you. My last question is, I just wanted to go back, and I have a bit of a different perspective than my good friend and chairman, Councilman Dom. As we talked about supporting businesses, I know that the councilman felt very strongly that we should not support, or that there just aren't enough resources. I won't say not support, but there's just not enough resources to support newer businesses that are starting up now. And I would say that I would take exception with that with African American and Latino businesses, because we have had so little support and we operate as African American businesses. I'm not sure what the percentage is for Latino, but we operate about 2 to 3% of all businesses here in the city of Philadelphia. So I would say that if there is a small minority business that is a startup, then we have to support them as well. I think that we can do both. We can support existing businesses and provide them with the support they need, and we can give, support to new minority businesses, knowing that 97% of the businesses in the city of Philadelphia don't look like those. So I think we must encourage and support African American and Latino businesses. So, and that's my last statement. Mr. Engler, I don't know if you wanted to comment, or anyone else about that.
No, I appreciate that. We have made a commitment to historically disadvantaged businesses owned, to support them through this. I don't know if Dawn wants to speak specifically to those efforts, but I think we absolutely hear your comment, appreciate it, and have been working to try and address it.
Thank you.
Real quick, Councilmember Bass, thank you for that question. We do have a guided work based on the equitable entrepreneurship strategy that the city and PIDC will focus our collective commitment on new investment and resources to grow local and small Black and Brown owned businesses. So some of these efforts will include a more affordable, flexible capital, targeted business support and resources for these small businesses and owners that are seeking to acquire real estate to build asset and wealth in their business. As many know, there are so many great minority businesses along the corridors, but they do not own the real estate that they're in. And ownership of real estate is one way of building wealth and creating legacy. So we want to make sure that we are taking a very targeted and intentional look at that. That work has begun.
Very good. I just want to make sure that, it's not a situation where, we're supporting businesses and, we're not asking the questions of, are you a new business? And then, when it's a black or brown person, all of a sudden now it's a new set of criteria or a different set of questions and say, oh, are you a new business? Sorry, we can't help you. So I just want to make sure that we're paying particular attention as we grow this economy and it feels like start over all over again, that we're paying attention to what commerce in Philadelphia is going to look like. So I thank everyone for their work.
Thank you.
Thank you.
Councilmember Bass, let me just clarify. I'm in support of helping new businesses and existing businesses, but I will say that many of the today we're hearing from the existing businesses, and they need to stay on. They've made investments, they've made commitments, they've been loyal to the city of Philadelphia, and many of them are minority businesses.
Yes.
Many are. And so we cannot let them go down. This is no fault of theirs that this is happening.
Councilman, I certainly do agree with you. And I think that, and you've heard me say many times that we can recover, but what are we recovering to? We don't want to recover and have, no place to go, nothing to do, no restaurants to sit down and eat at, no place to shop. What are we going to be recovering to? So obviously it's a great concern of mine as well. But what I am saying is that we can support our existing businesses that have been here in the fight with us in Philadelphia and have, invested their own time, talent, and treasury to make this city great. We can support them, and we can also support newer minority businesses because, as you said, there are about 3% of commerce in the city of Philadelphia. That number has long been unacceptable. And so I just want to make sure the administration understands that it cannot continue this way. And this is a perfect opportunity to make sure that we engage and encourage small minority businesses.
Well, I actually think the numbers, and we can clarify this, for minority businesses are closer to 30%. The problem is minority businesses that have employees, which we really need to work on. We need to teach minority business owners how to scale up their businesses. That's a separate commerce conversation, but that's really what we need to do because we have a lot of entrepreneurs. And
it is. And thank you for that clarification on the numbers. But most of those, that 30% is like, it's a one-stop shop. It's me. I'm doing everything. And it's not the kind of growth that we need for the city. So I'm talking about the businesses that are, significantly able to contribute to our tax base, to hire other employees, to, grow, to have other locations. We want to support that.
Right. Also supporting those 30% who are the one-person places because they
Absolutely.
Okay. All right. Well,
so as long as we're supporting minority businesses and making sure that there's room at the table for everyone, we just need to make sure that there's a commitment to do so.
Right. Look, our goal should be that everyone who's here in the city should be supported because this pandemic, no fault of theirs, zero.
Absolutely.
All right. So thank you, Councilmember Bass. Let's go to the next questions for our Councilmember Squilla.
Thank you, Mr. Chairman, and great job so far. I know everybody wants to hear from the people in the industry. It's really important. We know, and we've asked a lot of questions, but my big thing here is we understand what we have done as far as the businesses' closures and how that has impacted them. I think what we need to do as a city, and maybe we could ask Jim Engler, as we go to open up, and Councilmember Dama, as you had mentioned, a smart restart, we got to start thinking about how do we safely open up and how do we do it in a way with the proper procedures and policies in place. We understand with the close down, and we know January 4th is a state closure and the reevaluation of how that would happen in February. And Dr. Farley has stated that, this virus is taking the same track as many other viruses, is that, December, January is going to be probably the highest numbers. What we need to do is work together with Commerce, and I want to thank Commerce, and I think Councilmember Jones said this. Commerce, L&I, Streets, Revenue, everybody's really been working hard to try to get resources out. Yes, we as a city do not have enough resources to give to everybody, and yes, they are struggling, and we support the federal stimulus that's hopefully coming shortly. But I think our concentration now has to be on how do we smartly open up our hospitality industry and, our arts and culture industry. We know that our museums that are out there, our places of arts and culture, are struggling through this. A lot of nonprofits. We need to really address those issues and look at ways that they could operate safely. Even with the vaccine, this is probably going to be till the summertime till we start to get back to some type of normality or some type of herd immunity. So we need to really help these folks come up with these ideas. And this hearing is perfect for that because we get a chance to hear from the industries of how they could do things safely. We get a chance to hear from museums of how they're making sure when people are coming in there, they're wearing proper PPE and keeping social distancing and doing these things because we're going to have to do this for a long time. So, closure and maybe what's happening now, but I think we're looking to the future of opening. And I think that's what we need to really concentrate on. And I know Jim Engler said that they're committing to meeting with these industries and have them having a seat at the table, whether it's the restaurants and hospitality industries, the hotels, and then whether it's the museums and the arts and cultures industries. But what is our plan for opening and making sure we're listening to, they have the ideas. We as elected officials and sometimes in our space, we look at a global picture, but they're very concise on what they want. So what are we going to do to work with them and to make sure we put things in place as we do this smart reopening and as they feel like, all right, we're starting to see the light at the end of the tunnel so that we could get them up and rolling?
Sure. Thank you, Councilmember. So as mentioned previously, we've started that engagement. We've started that engagement with some folks that will testify today, as well as other industries who may not be represented in today's testimony. We've asked the Commerce Department to convene that, but as previously committed, we'll have folks from the Health Department, from the Mayor's Office, from other impacted city departments participate in those discussions. We want to hear directly from businesses about their ideas and how they can operate safely. We've started those conversations with restaurant operators about ventilation support and ways that they could allow for indoor dining with improved ventilation. We want that level of feedback. We're watching what happens in other jurisdictions, in other countries, what's happening in Europe as they ease off some of their restrictions, and what's happened in other areas of the world where they've seen significant mitigation of spread, places like Australia, New Zealand, those types of places. So, we're anxious to work with business owners here about how they can reopen safely, but we are still operating on an emergency basis. The restrictions that we implemented in November was because of a brewing emergency, specifically around hospitalizations. That continues today. We have more people hospitalized today than just about any point in the last year, except for the very peak of the pandemic back in late April, early May. So we need to continue to work to stop the spread of the virus and to limit our hospitalizations so our hospitals don't become overwhelmed. But there's a commitment from the administration with the convenings that the Commerce Department is doing and with the appropriate representation of city departments to hear from businesses directly and to move forward with operating plans and proposals that help us mitigate the spread of the virus and allow them to operate safely.
And I think we all agree with that, safety first. But I think the concentration now has to be on, as we protect people and make safe, we have to also parallel be looking at opening, because eventually we're going to be opening in February when the numbers are starting to go down. You're going to start having openings and doing things, but we still want to do it safely. Not everybody's going to have a vaccine. So, that's why it's important to do this. And I'm glad to hear that is happening. I'm glad to hear that this hearing is happening because together I think we could come up with a way to do this. And sometimes making unilateral decisions and not hearing input from everybody, it's overwhelming for the administration and for the health department to come up with those things. So I want to, just be, I guess the most important thing is each industry has an ability to represent themselves at these conversations, and so we could hear that and then make sure that as we roll these things out, we still have to monitor the numbers, we still have to be safe, and to make sure that they are going to be open smartly and safely. And then again, I think Councilmember Dom had said this. There's always some people out there, no matter what regulations you put in place, are not going to follow those guidelines, and that's something we need to enforce and to be very engaging on. But at the end of the day, you don't want to throw the baby out with the bathwater, and you want to make sure that we do this in a way that's smart, safe, and that the people who are involved in these businesses, there is accountability for that. So if you're going to have a business and we're going to operate safely, but you're doing the wrong thing, then there are consequences. And I think that's important also. So we have to also, beside having these policies in place, we need to also have what the restrictions are and what the penalties are for not following those policies. And if we do that and people know it, that'll be easier for the businesses moving forward. So hopefully that'll be part of the conversation also. Thank you, Mr. Chairman.
Thank you, Councilmember Squilla. Stay well. Thank you. And I think our next up is Councilmember Maria Quinona Sanchez.
Thank you, Mr. Chair, and thank you to the members of administration. I personally want to thank everyone who's worked incredibly hard under really difficult situations to get us to where we are today. I have a couple questions for Rob DeBow, because I think one of the important things as we talk about a smart restart is there were some industries that didn't get closed and are doing extremely well, as Council Member Bass alluded to, some of the neighborhood stores and others. Are we seeing that level of activity based on their tax returns? But the big, I think of the Walmarts, the Targets, and all those others. What are we seeing, and what are the opportunities that exist there for these businesses who've managed, to have empty shelves during this troubling time?
Yeah, so I think part of the reason that our overall taxes have not gone down further than they have and have been consistent with what we thought they'd be through the first few months of the year is that some of those businesses have been doing well. I think, as you know, we're not allowed to look at specific businesses' returns under our agreements with the IRS. But I do think the activity in those businesses has helped us not have a worse financial condition than we have right now.
But we're able to look at which sectors, again, in aggregate numbers, which sectors in the city of Philadelphia are doing better. My thing is, are the businesses that have not suffered any shutdown, are their returns reflective of the policies, the health policies that we've established?
I'm sorry, say that again? I missed the last part of your question.
I'm saying, are they, the businesses who've not been shut down at all during this, the essential businesses as we've described them, again, the big stores, the Walmarts, the Targets and stuff, can we not look at their numbers in aggregate to see if the activity based on the decisions we're making about who stays open, if their tax returns are reflective of that? Are we able to look at that?
So we can see, for example, that, supermarkets have held up fairly well, but we can't see whether that's large or small.
Okay.
Right, so we can see it by sector, but we can't grade it by size within the sector until we start to get returns, which comes much later in the year.
I think we have to be really prepared to look at all of that information about what we learned around businesses and some of the shutdown, the decisions we made around who pays, right?
Yep.
As you know, I'm of the belief that these big multinationals don't pay enough, don't pay anything sometimes, into the market, and through this pandemic, they've been the ones who really have benefited from our health policy decisions about who stays open and who doesn't. And so I just think there's an opportunity there for us to look at how do we, as in a smarter restart, how do we not penalize some of our locally based businesses who are living through these, very localized decisions that we're making. But I understand, we'll work with you. Can we make a request through the Fiscal Stability Committee for the administration to look at, I mentioned this before in our last meeting, January 1st, February 1st, March 1st is all of these due dates for businesses. Can the administration crunch those numbers and give us a sense of what are some of the due to the cities that we can, as you guys have done with the trash refuse delay, are there other pieces of the business component that we could be looking at and potentially waiving, if not, delaying payments as we move forward in January, February, March?
Sure. We have done that, as you know, with things like extending the BERT tax deadline, extending the property tax deadline, changing the way we calculate the UNO. But yes, we are happy to keep looking at those and see where there are opportunities for relief.
There are sectors where we've asked folks to make some sacrifices with us. I can think of the housing world where we've asked people through this eviction stuff to delay, on the eviction, what rental licenses, what fees are coming up due date for those sectors that are hurting that we can, again, revisit and say, can we waive this? Can we delay? I think we had this conversation as it related to the lead implementation and the health department pushing forth the lead implementation while we're asking landlords not to collect rent. So I think, and again, it's sort of like there's different sectors. We've asked them to share in some of the pain with us. What can we as government do to facilitate that? And obviously, no interest in penalties during this time where the Revenue Department has been, very cooperative. But more than that is telling folks, we understand that the next 3 months are precarious, where we have a shutdown. What other things can we be looking at? And we need to see those numbers to see what we can do. One of my concerns as we try to, balance out how do we provide businesses support, with all of our business measures, starting from our first 3 portfolios of where we put money on the street, we want to be equitable. We keep saying equitable, but when we put out an application and we say you got 5 days to fill it out, or if not, you don't compete. I think what you're going to hear from some of our council district, as you have heard from Councilwoman Bass, we have folks who just, we've told them to apply 5 times and they're not applying anymore, right? And sort of like, how do we really create some broad-based relief that everybody feels and is more equitable as opposed to some of the things that we've done up to now? And if you guys thought a little bit around that, again, rental license, rental suitability license, there's a bunch of things that come due. The numbers may be significant in our cash flow, may not be significant. If people don't get a renter's license, it doesn't mean they're not renting the unit. That means they can't afford the renter's license.
Understood. We'll continue to look at that and we'll get back to the committee.
Okay. And then for Jim Engler, I think, again, this is around where health policy and finance policy come to meet and the importance of the mayor's office to be involved in that. We want departments to make decisions about what is right, not because of what they're held accountable to. And revenue is one of those numbers where, whether it's L&I, streets department, all of those things, it's sometimes unfair to ask these departments around these questions if the expectation is that they're going to bring revenue. What have you heard from your departments and what discussions are happening at that kind of level around where we can ease the burden to the city for folks that we're trying to help through this process, particularly for sectors that we've asked us to make sacrifices for us?
Sure. So we've had those discussions. I think you've seen the start of that with the pushback of the commercial trash fee collection, the issues around UNO and BERT, to the finance director's point. We will do that. We'll continue to have that level of engagement with Department of Licenses and Inspections and others. I think that for a number of the departments that are inspection-based and for the permits that are inspection-based or the licenses that are inspection-based, it's important that we continue to get that information. To your point about the waiving of the fee, that's something we can absolutely look at. I know it's important for L&I to to continue to get rental suitability licenses in so we can do our housing inspections to make sure that the housing stock is safe for people to live in. But you have the commitment of the mayor's office and the administration to continue to work through that as we go through the rest of this fiscal year and as part of the next budget cycle. We know we're going to have to continue to look at the different levers that we have to better support these businesses, whether it's through licensing and permitting or through our taxes and revenue. So we're committed to that, and you'll see us continue to engage on that over the next several months.
Yeah, I mean, again, I know we're doing the best we can with what we have, and we have small arts groups, as we have some of the commercial corridor piece that we're all very concerned about, including the Center City corridor. We've done several different initiatives. We did the first ones that the loan, the $5,000, $25,000 grant. Then we did the CDFI one. What would you say were lessons learned that, as we're working on, how do we put this next relief out there? And obviously the hospitality industry and the restaurant business being one of the places where council leadership and administration are working. What is the best product line? What have you heard? Where have we missed? Or who are we missing, or who has been missed in this conversation that the administration feel needs to be prioritized as we move forward?
So I'll let Dawn speak to some of the specific lessons learned around those programs. I think from our perspective and looking at the federal program specifically and how that facilitated and made its way down to businesses or didn't make its way down to businesses here, I think that's a tremendous missed opportunity. And the fact that the Congress is about to double down on that is another missed opportunity. So there's changes that we can make there. For our dollars, I think that we've done a good job trying to limit the paperwork. Understand that's still a barrier for folks, but we have tried to be very intentional about limiting that paperwork. To your point about broad-based support, I think that's something we can absolutely look at doing. But we're trying to balance both broad-based support and very targeted intentional support for the industries that are most impacted by the virus. So it's really trying to find some synergies there where those 2 points meet. But I'll turn it over to Dawn to talk specifically, because I think we have iterated throughout this process on the business loan and grant side and on the rental assistance side in really tremendous ways that'll help us improve the way we operate going forward.
Yes, thank you. Councilmember Sanchez, I think, some of the challenges that we've seen is to ensure that we're not creating layers of bureaucracy when we're trying to get dollars out to the street. I think a lot of the small businesses have been very appreciative of the support, the grants that they received, that we did not try to attempt to make those dollars restrictive to what they needed them for, whether or not it was to secure employees, whether or not it was to pay rent, to get merchandise in for them, to allow them to pivot during the pandemic. And that is something for the next round of dollars going out that I think we need to be mindful of and intentional of. Councilman Jones talked about the lack of insurance coverage. That has been a challenge. Councilmember Richardson, spoke to making sure that dollars were going out to the street. And I think our collaboration, again, with the health department, our collaboration with revenue, just taking a look at what the needs are of the businesses and how we can support them. They don't want restrictions. If we're supplying a grant, they want to be able to use that money to keep their business going. And I think that is the best thing we could take a look at, whether or not it's the licensing, whether or not it's, them being able to pay rent, whatever that is, we need to be able to support these businesses to keep them moving forward without a layer of bureaucracy on top of them going through the process for application.
Thank you. And no one wants to be kind of told how to spend their money because they're making day-to-day decisions as our residents, right? Who make day-to-day decisions about food and what they're going to do. with the first profile, and I know we've asked the Commerce Department for some data to share with leadership. We had 10,000 plus applications. About, even with all of the different supports, about 6,000 of those were still unfunded. What is the profile of the small business that we've missed in Commerce's view, that we've missed and not had the ability to have access to? Either they didn't have access to our process, or that we don't see significant in the profile of those neighborhood-based businesses that we want to support.
I believe we had a good round of restaurants. We've had a good round of small professional service businesses. We've had a couple of manufacturers. I believe we've covered the gamut. I think who we did miss was those who did not have a footprint of business activity in the city. So they didn't have tax records that were readily prepared, either their fault or not their fault. And that comes to technical support that we're providing for those businesses to get prepared for next opportunities. We were very intentional about who we were targeting this to. We were targeting to small businesses, not the larger corporations that can sustain themselves and that have lobbying efforts already in place. But those businesses that were, whether or not on the corridors, the apparel stores, the sneaker stores, the independent mom and pop grocery stores, those are the ones that we were targeting for support. And in this next round, as we take a look at the restaurant industry, once again, the gyms and some of the other sectors that have been named here today, that will be the focus for the next round of efforts.
And then lastly, some neighborhoods were hit more than others with the social unrest and the looting. How have some of these supports helped some of those businesses directly impacted by the looting? And is there a portfolio of those types of businesses that we were able to get to who had, twice the challenges? They had pandemic, and then they had the social unrest and the looting that impacted their business.
Those business, again, Commerce Department went out, met the needs of many of those businesses by providing support. We also know along coordination that we've done with a lot of the corridor managers along 52nd Street, which was severely hit. A lot of those businesses, many that were burned down, had insurance in place. Some of them did not. So we've been coordinating with our support efforts through business associations and CDCs and partnering with them to help stabilize those businesses that are in their communities.
Can you give me an example of when you say you're working with your Carter folks to help stabilize them? Has there been direct grants given or support given to businesses who were impacted by the social unrest and looting?
There has not been direct grants. There were support coming through, connecting them back into talking to our support for small business through the CDCs or working with 52nd Street, for instance. So there was a operation there that was burnt down. There was a support or Asian store that was burnt down, and they received some support from 52nd Street to help clean up, to help board up. But this city is working, continues to work with those organizations to figure out next rounds of support as well.
Thank you, Mr. Chair. I know this is really difficult and we have to make really tough decisions because we don't have all the resources for everyone. But I think, to Jim Engler's point, I appreciate the administration understanding there are different triggers. Some money we can get out in the street, and other things there's levers that we can push. And as long as everything remains on the table, I think what we're going to hear from this afternoon is businesses that, appreciate the health component of this, but also want to be able to present, plans that are thought out about how they can open up in a healthy way to survive. And as long as we remain open to that everything's on the table and how we do this, I think we can do both. And so I appreciate everybody's willingness to stick in here today and get us to a better place. Thank you, Mr. Chairman.
Thank you, Councilmember Sanchez. And now, good afternoon, Councilmember O. I know you had some questions. Councilmember O. Well, we can come back to Councilmember O. Maybe there's some technical issues there. So I want to thank the administration.
All right, thank you very much, Chairman Dom. I am having connectivity issues again, so I'm just gonna keep my video camera off. I hope you can hear me.
Yes.
Okay. So I do have a question. I'll just state at the beginning that, I do meet with small businesses that I don't think meet with the city. I think there are small businesses and businesses that have an ability to meet with the city through whatever existing mechanisms there are, but I generally hear from angry businesses all across the city, every different type of ethnic group, angry, upset, and they have no ability to access the city. And the money, and I appreciate the efforts on the money, is minimal. The application process is very difficult. And as soon as people begin to apply for the money's gone. And it is what the city can do, but I want to assure those people listening who have spoken to me that I understand that the money is not accessible to them. And so the idea that we do the best we can, but it's nowhere, I won't even say near, it's nowhere close to the parking lot of the ballpark of what these businesses need. So getting past that, what I am going to ask is, and I know Dr. Farley has left, but I'm going to ask the administration, if we are going by science and data, and I believe we're trying to, can someone explain to me, if we're going by the CDC study, and there are more extensive studies out there that will only further confirm these issues, but according to the CDC study that we seem to refer to, there is no statistical increase in risk for people to use public transportation and to go shopping. It didn't say what kind of shopping. It just said shopping. And so we are allowing people to go to public transportation, but we allow people to go to big box stores to shop, but they can't go to small stores, even those that are complying with restrictions of distancing, masks, and occupation. So shopping, some places, not all places, public transportation seems to be okay. But the same CDC study said that there's no risk if you go to religious services, synagogue, mosque, church. And so you can go to Target and Walmart, but you can't go to church, mega church, tiny church, whatever it is. And I'm okay with that if you could provide the science behind it. And as far as gyms and health clubs, those are extremely safe in numerous studies. So the CDC report shows no risk if you go to a gym, and many people have said, including medical people, that you need exercise and gyms are safe, partly because these are all regulated industries in the sense that they have to comply with inspections, things like that, or that by the clientele that they have. In other words, people who go to gyms are very healthy people and they don't want to go to a dirty gym and get sick. Very similarly, people go eat out at restaurants. It's highly regulated, and a restaurant does not want someone to get sick or have bad food or food poisoning in any sense. Certainly the ones that are complying with all the regulations and CDC. So I'd like to understand, what is the difference with this CDC report? Because when we close off people to going to places that they go to that are not of increased risk, they do stay home. Staying home and congregating without all the regulations, the cleanliness, the inspection,
restrictions, the social distancing requirement, that's where people are also getting very sick. They have an increased risk of COVID-19. We've seen that in New York, where the very people who will not go out their home, that kind of lock their doors, they're the people that were getting sick with COVID-19. And I'm not endorsing anything like, we should be out and about. What I'm saying is I'd like to understand, so that people can have trust in this process, how we're distinguishing one thing in a CDC report from another thing. And I think that's important, and I'm going to give the administration a chance to answer this question, because what is not said, but which I very much believe, is there's a absolute strong correlation between unemployment, poverty, and health risks of all sorts, including COVID-19. People losing their jobs, losing their health care, losing their savings, unable to pay their rent, losing their homes, can't pay their mortgage, having depression. We have a sharp increase in drug addiction among restaurant workers. All of this, if it is not necessary, we should avoid. If it is necessary, we should do it. But there has to be some science or data to show that it is necessary. Thank you, Mr. Chairman.
Thank you, Councilmember. Just a couple points in response. I know Dr. Farley, unfortunately, had to run to another engagement. I would start off by saying I think that if there are businesses that are engaging with you, they are in fact engaging with the city. So if there's feedback that you have from those meetings that you'd like to share with the operating departments, with the mayor's office, with the administration, we're happy to take that. And I think the engagement that our business owners have with all their district council members and their at-large council members is crucial. And we want to get that feedback in addition to what they can deliver directly to the administration. I'm not familiar with the CDC study that you specifically represent. When we discussed the restrictions for the city of Philadelphia, we looked at certain kinds of activity that would either allow for people to come in contact with other people who are not from the same household, or would conduct activity that would either be highly aerobic in nature, which can spread additional droplets, and activity that would happen unmasked. So that's where we targeted our restrictions. I'm not certain to your point around retail establishments. What we did was restrict the capacity of retail establishments. We did not require that retail establishments close, regardless of their size, with the latest rounds of restrictions. So I don't understand that specific point. But we are trying to balance with this latest round of restrictions that I think that the governor acknowledged in putting additional restrictions statewide that are substantially similar to what we implemented, that we really tried to target the most dangerous activity, the activity that we think has the highest likelihood of possible spread of the virus, and could cause the highest amount of spread. And that's where we tried to mitigate.
I appreciate that. And I appreciate you, Jim Engler. You are always a gentleman and a great representative of this city. So I will say, listen, my concern is, for example, that anecdotally, I would agree with you, but data-wise, the data is not what I would expect. For example, in addition to the CDC report, because let's say gyms, that's a typical thing where you're sweating, breathing, sharing equipment, that type of thing. But the Stanford study and other studies have indicated, like, one of the safest activities in terms of, or populations of demographic of people who do not get COVID are people who go to gyms. There have been a lot of studies around gyms. Stanford University, all of them, range from no risk to, a minimal risk, far less than the average person living in the United States, for whatever reason that is. And I'm not trying to promote the use of gyms. What I'm saying is that I like to understand that, as opposed to what I may imagine, if the data says and shows, and these studies show that,
it's not happening in certain industries. The CDC study that is being referred to looked at 314 people, 160 who tested positive, 154 who tested negative, and they asked them a series of questions. These are in 10 states nowhere near us. And there was no contact tracing. It was just a question, and it's twice as likely that the people who tested positive in the 2 weeks prior to them feeling ill had eaten outside of their homes. Now that's a actual data fact. So I'm fine with that, but it wasn't contact tracing. It wasn't here. And to my knowledge, when we're looking at contact tracing and data, which I think is a little problematic in Pennsylvania, we would be able to go back to which restaurant or which street, what location. That's what's happening in Australia, in countries that have really defeated, the risk of COVID, the contact tracing and what they do, door-to-door delivery, door-to-door. They are doing that. We're not doing that in this country overall. But when we do kind of like wholesale, kind of like, it anecdotally sounds correct, that's when it's troubling to me, because the unintended consequence may be increased risk and more COVID-19 as opposed to less.
Sure. So I think to your point around studies, there's also a study out of Yale University that looked at restrictions, county-based restrictions, and contiguous county-based restrictions, and those that are most likely to reduce the case counts and reduce the spread of the virus. And they did center on a number of specific industries, including gyms and restaurants, as when those closures happened, there were significant reductions in the transmission of the virus. Back to another earlier point that you made, I do think that we take very seriously the social determinants of health and their impact on the overall well-being of our residents. So to your point around higher incidence of mental illness and addiction and those that are either facing unemployment or business closures because of this, we take that very seriously. Want to get support to those that are suffering from that, and want to overall support our residents through what is an incredibly difficult time, whether it's being separated from friends or family or just from society generally. So I think we take that very seriously. We've tried to be very targeted in the restrictions that we impose, understanding that that targeting may impact businesses that have been operating to their best of their ability very, very safely. But we know how respiratory viruses spread. The health department is very skilled at figuring out how respiratory viruses spread, and we've targeted those industries that we think are the highest risk for spreading a respiratory virus like COVID-19. We've seen some early success in that. If you look at our data compared to the Commonwealth overall, when we imposed our restrictions, we actually started going down at a much faster rate while the Commonwealth was continuing to go up, and our rate of increase since the Thanksgiving spike of cases has been at a slower rate than the Commonwealth overall. So we're seeing some of the benefits of that in our case count and our slowed hospitalizations, but we understand that there's some businesses that believe that they operate completely safely, and maybe they have, but we try and operate based off of a certain risk factor.
Thank you very much. Thank you, Chairman.
Thank you, Councilmember O, and I want to thank the administration for being here today and for your ongoing oversight of our city's health and safety. And we hope this is the start of more discussions about the data, policies. And we're also going to hear a lot of testimony this afternoon from people in the business. And I hope we have an open mind to figure out how we can have that hopeful middle ground where we can maybe have some sort of a safe restart of our economy. So Ms. Gerbach, please call the second panel of witnesses.
All right, on our second panel, we have Lauren Gilchrist, Ben Felicia, Mike Palermo, and Nicole Marquis, who I believe will be testifying first.
Okay, thank you. In the spirit of time, I know you've been very patient. Thank you. If you can keep your verbal testimony to around 2 minutes, if that's possible. We know you've submitted written testimony, and that's great. So let's start with, I believe, Nicole Marquis first.
Yes, good morning or good afternoon, City Council and the members of the City Administration. Thank you from the bottom of our hearts for all you are doing to try to keep our residents safe and keep our businesses running during the most challenging times imaginable. And thank you for giving us a seat at the table now. Save Philly Restaurants Coalition is relieved to be meeting with the Mayor's Office, Commerce, and Health Department each week. I know some of you have heard some of my impact statement before, but since we met last week, things are more dire for our industry and our city. We have lost more restaurants and we are more desperate for any kind of assistance. We join you in seeking the path that presents the safest path forward for all of Philadelphia. We ask that you truly look at the current science and the current data. We are proposing only science-based, safe solutions that serve the public interest. Yesterday, I spoke to one of my employees, Vance, who has been one of my dishwashers for 4 years. He called me because he was upset because he doesn't understand why he's not on the schedule this week. I had to console him. The mental and emotional trauma of being let go from work again without any certainty of support from the city, state, or federal government is devastating. He has a family to feed. These are things that we can do now to keep people working. I will speak about them, and to do it safely without spreading the virus. A lot of people who are being let go are in jobs where they can't easily find other work, and they are the most economically vulnerable. For example, one of our top asks in the past has been free COVID testing for our staff, so we can keep employees and customers safe, reassure them, and quickly control a scare and get back to business if anyone on our teams does test positive, as well as save thousands of dollars in testing when a COVID scare does occur. After waiting in vain for 9 months for some kind of action on this from our elected leaders, just this week, Save Philly Restaurants announced that we were able to secure free weekly testing for our workers and their entire families. But there is more that we can do right now. Save Philly Restaurants is a coalition representing over 250 restaurants and bars in the Philadelphia area. We employ tens of thousands of fellow Philadelphia citizens. We pay millions of dollars in city taxes each year, and we are a major part of Philadelphia's role as a national tourist destination. We are essential businesses in that we feed Philadelphia. We have joined together during the COVID-19 pandemic to fight for our safety, for our employees and customers, the livelihoods and well-being of our staff and vendors, and to prevent more of our fellow business owners from closing their doors forever because of the unique and crushing challenges presented by this time. We believe we can effectively protect the public in our venues while preserving the essential restaurant industry in Philadelphia. And we recognize the gravity of the situation, and we take our responsibility very seriously as essential businesses who are feeding the public and providing jobs and tax dollars. We support the CDC guidelines, and we realize the most important thing for our health and our economy is to get this virus under control until we all have a vaccine. I have seen the devastating effects of this virus firsthand, from dear friends, family members who have passed away from COVID, to hearing my lifelong friend who is a nurse sob as he talked about intubating 10 people in a single day. I have seen the fear on my parents' faces when someone they know is diagnosed, and I desperately want to keep my son's abuelos safe and healthy. But have no doubt, without urgent and dramatic action from the federal government, the city and state governments, this winter, we are going to see not just a business crisis, but a humanitarian crisis as well. A colossal human toll emanating from a far worse wave of business closures, layoffs, evictions, and resulting social ills such as depression, drug abuse, and homelessness than we have seen so far. We have followed the advice of experts, and we have instituted additional safety measures such as reduced capacity, social distancing, mask and shielded servers, increased levels of sanitation, and in many cases, partitions and new HVAC systems that greatly increase the air exchange rates in excess of CDC recommendations. The unintended consequences of these new restrictions is to push more gatherings into people's homes, which is inherently riskier, as social distancing and serving protocols aren't known or enforced in private homes, and is more closely tied to an increased infection rates than is restaurant dining. These restrictions on Philadelphia businesses are effectively killing more businesses while potentially sickening more of our fellow residents. We have to balance public safety concerns about the virus with the latest scientific research and other social concerns to avoid making a grave mistake. We all agree that the public safety during this pandemic is our most important consideration. We cannot currently serve our guests in the way that we did in the past. We recognize that during the pandemic, indoor dining without appropriate fresh air exchanges and without appropriate HVAC systems improvements can be problematic. The science indicates that indoor spaces can be made safe with appropriate air handling technology. Studies have shown that modern HVAC equipment, which provides 10 or more air exchanges per hour with features that can actually filter and kill the virus, are available and relatively affordable. This technology has proven safe and effective for years in hospital settings. However, with the losses we have all incurred this year, we need your help and partnership to equip our establishments with this technology so we can continue to serve the public safely now and in the future. It is interesting and ironic that the studies being widely cited now to support imposing new restaurant operating restrictions actually support the position that restaurants can operate safely. The studies and the data actually indicate that dining at restaurants has not been a material source of COVID spread. For example, the recent study we saw from New York showed that 1.4% of COVID cases can be traced to indoor dining at restaurants and bars over several months, and that is without any air quality improvements in place. The same study showed that 74% of cases were tied to gathering in private homes. Other national studies indicate that up to 55% of cases in other cities were traced to visits to large retailers. Focusing on closing restaurants, only 1.4% of virus cases, thereby encouraging people to obtain food by visiting large retailers, up to 55% of cases, or to gather more frequently in private homes, up to 74% of virus cases, makes no sense from a scientific or statistical standpoint. That is 50 times more cases from private gatherings than from restaurants and bars. Restaurants can be made safe with social distancing and the proper HVAC equipment, and this could prevent some of the current business closures and layoffs. We see ourselves as good faith partners with you, and we realize we all have the same goals: public safety and the preservation of our jobs and businesses in our beautiful city. Let's work together to save Philly restaurants because it is in the best interest for all of us and what restaurants and their employees need now to survive. Number one, we want an announcement as soon as possible from the city that we can return to the previous outdoor dining restrictions. The limits that were in place before the new restrictions were issued were logical, and we definitely agree with them. We don't, though, believe the new limitations have public health benefit, and they are very difficult to enforce and have already severely limited our ability to earn revenue from outdoor dining. Outdoor dining with groups of 6 or less with social distancing is an inherently safe activity. Number 2, we oppose any blanket announcement that our establishments cannot sell alcohol after a certain time in the holidays. This is devastating to our businesses, and we want to be able to capture some evening sales on popular dining holidays, including selling alcohol at outdoor tables and cocktails to go. Third, we believe that the city should allow restaurants with the capability to offer al fresco style space with fully opening windows and doors that can create indoor and outdoor spaces with outdoor air quality equivalent to outdoor spaces, to utilize these spaces along with mask use and social distancing guidelines. We should not be forced to build new indoor spaces outdoor in the street when many of us can provide outdoor air quality within our existing spaces. Fourth, we believe that the city should consider air quality science when deciding if indoor dining can be safely permitted by establishing appropriate standards for ventilation, air exchanges, and indoor air quality. The studies cited in the new restrictions are not looking at restaurants with enhanced HVAC, HEPA filters, UVC lighting, and other technologies that kill the virus and other protective measures in place. Technology is available and easily accessible that can get the air in our restaurants as clean and fresh as it would be in a hospital operating room. We ask that you work with us to begin now and January 1st to develop science-based air standards to return to 25% or greater indoor dining capacity as soon as it is possible. And number 5, the city should shut down more streets to traffic 7 days a week. The restaurants can do all they can to keep staff employed, drive revenue, and serve customers outside. This is already being done on 18th Street with the reduced traffic and increased need for outdoor seating. This could be done rapidly and easily in many more areas of the city so that those establishments can put up tents and build outdoor structures to try to drive some winter revenue and recoup losses in 2021. 6, and lastly, give restaurants immediate grants to winterize their outdoor spaces. Restaurants should be eligible for grants of $10,000 or more per location to equip our spaces for these new restrictions and to help us make it to the spring. Time is running out and January 1st is around the corner and we need a plan. Let's discuss these options and work together. There is no other way. Thank you so much.
Thank you, Nicole. Thank you very much. Thank you to Save Philly Restaurants and all you're doing a great job. Next up is Lauren Gilchrist from Jones Lang LaSalle, JLL. Lauren.
Thank you so much, Councilmember Dom. I'm going to share my screen here to cover some of the charts that are included in my written testimony. Are you able to see it?
Yes.
Wonderful. Thank you so much. Members of council, my name is Lauren Gilchrist, and I'm the Senior Vice President for Research at JLL in Philadelphia and also the current chapter president for NAAP Greater Philadelphia. JLL is a global commercial real estate services firm around the world, and NAAP is a professional organization for commercial real estate developers. Thanks for the opportunity to testify regarding our findings of our recently released report on retail, Center City Retail, how Philadelphia's Walnut and Chestnut Street corridors will navigate COVID-19. This report examines how we got to our current state in our High Street retail corridor, what the impact to retailers and the market has been, and what the path forward looks like. Please note that while our data pertains specifically to these High Street corridors downtown, we believe most commercial corridors are experiencing the same challenges at this time. Since the start of COVID-19 in March 2020, foot traffic from store visits along Walnut and Chestnut between Broad and 19th dropped off an astounding 98% by May due to the closures enforced by health restrictions, picking back up somewhat as the economy cautiously and slowly reopened over the summer. This stunning trend exacerbated already prevalent trends in declining in-store sales caused by the effects of e-commerce, which comprised about 11.8% of all U.S. retail sales prior to the pandemic and now make up 16.1% of all retail sales. So this first chart looks at 2 retailers, Lululemon and Nordstrom Rack, and we've also provided data in the testimony for Apple and also a restaurant, the Continental Midtown. You can begin to see some of these trends very clearly as to where they were prior to the pandemic and where they arrived prior to the most recent round of health restrictions. Categories most significantly impacted by the health crisis and subsequent closures include bars and restaurants, as we've talked about today, which experienced 41 to 66% declines in retail spending during Q2 and Q3 2020 as compared to 2019. Due to work from home mandates, a loss in overnight visitors, and a decimation of the hospitality sector, we expect that Center City has lost more than $1 billion, and I'll repeat, $1 billion in retail demand this year. While rebound will continue to occur slowly and surely over the next 12 months, by this time next year, our estimates suggest that 2021 retail demand levels will only be about 50% of what they were pre-pandemic, or $639 million in the downtown versus about $1.28 billion in 2019. This cumulative drop in demand, coupled with the burning of key retail buildings along this corridor, has resulted in substantial occupancy declines. Currently, retail occupancy on Walnut from Broad to 19th stands at a mere 55%. This chart looks specifically at each individual block. You can see, that certain blocks have experienced more problems than others. And Chestnut's occupancy level stands at about 77% over the same span, Broad to 19th Street, faring a little bit better than Walnut Street overall. Because downtown retail is so heavily dependent on commuting office workers, tracking their return to work is key to understanding the path forward. This is a JLL estimate that we've put together. We would estimate that prior to the pandemic, about 10% of all workers worked from home. During the pandemic, we've seen more workers obviously work from home. We'd estimate about a 10% office occupancy level. As I said in the Inquirer, the butts in seats phenomenon. And we anticipate that while this will rebound, there will be lasting effects. JLL estimates overall about a 5% decline in demand for office space by 2023. This decline is 15% due to work from home, so bringing the total work from home phenomenon to 25% of all workers, but some modest increases in de-densification, i.e. more space per office worker, as well as some increase as a result of job growth. We believe using these figures, we think the downtown economy will be in a better position by the end of 2021, but additional stimulus will be necessary to sustaining businesses given the gravity of the situation. This chart specifically looks at our projections based on the most recent health restrictions as to where we think we will end up by the end of 2021 in the city of Philadelphia. So you'll see that whereas we estimated about 124,000 office workers in the downtown in February 2020, we believe that by the end of next year, we'll only see about 107,000. Thank you so much for your time this afternoon. I'd be happy to take questions now or at the end of the panel.
Thank you, Lauren. Great presentation. I'm going to ask us to hold our questions to the end of all of this current panel. So let me go to Ben Valekia next.
Hey, good afternoon, everybody. Thanks for having us today. In the beginning of the pandemic, in the beginning of the year, Philadelphia had roughly 500 full-service restaurants or operations. Just in the past few weeks, we've seen 50 permanent restaurant closures, and over 100 restaurants that have temporarily closed for the winter. 66% of the remaining restaurants feel that it's unlikely that they will be in business in 6 months without an additional relief package from the federal government. Currently, but there were over 582,000 restaurant jobs in Pennsylvania, many of them in Philadelphia, which is 10% of the employment in the state, but the second largest employer. 91% of operators since the beginning of the pandemic have had to lay off or furlough their staff. Many of those people are still out of work. Right now, the industry desperately needs grants to help bridge the gaps until restaurants can start operating at 100% capacity again. The $7 million plus minus in unspent CARES dollars that the city has would be a really good start. And these could include, but are not limited to, grants to upgrade HVAC systems, as Nicole was talking about, grants for additional PPE and plexiglass installation, grants for hazard pay for employees. Since the beginning of the pandemic, the PRLA has taken the lead, and we are thankful to Philadelphia City Council for working with the PRLA on the following pieces of legislation. Bill 200574, the Restaurant Eviction and Financial Relief Bill, introduced by Councilman Heenan, which provided much needed relief for restaurants who are feeling the financial burden during the pandemic. Bill 200497 and 498, which was an extension for outdoor dining and street closures, introduced by Councilman Dom, that helped streamline the closures of streets and outdoor dining for many restaurants. Also, Bill 200344, introduced by Councilwoman Parker, which helped to reel in the third-party delivery companies from predatory behavior. We do ask that the city of Philadelphia creates a direct avenue for restaurants to report violations. This bill passed months ago, and we are still waiting and doing most of the work with Councilman Parker's office. A huge shout out to Rachel Meadows, who has taken a lot of these calls. Lastly, thank you to Councilman Heenan and Dom for helping to move along conversations with the Department of Revenue. These conversations the PRLA and the council member's office had led directly to the following: amending the UNO to exempt portions of the restaurant and bars used for indoor dining. Businesses can amend their BERT taxes and receive funds, and an extension on the refuse fee. So we are thankful for those council members who sponsored and co-sponsored these pieces of legislation, and look forward to continue working together to help our restaurants in Philadelphia try to survive and eventually thrive. So thank you for your time, and of course I'll be here for any questions.
Thank you, Ben. Thank you very much. I'd like to call our next panelist, which is Michael Palermo from Star Restaurants.
Hi, everyone. It's Michael Palermo from Star Restaurants. I've been working with many contractors in the city here that support us, and working with a couple architecture firms. And I've been building these streeteries that are heated and COVID compliant. And we've been working with the health department to make sure that these streeteries really meet all the COVID guidelines or exceed them. I've also tried to help all my fellow restaurateurs as you see these things popping up. It's very important to us because at this point we've built 12 of them in the city, whether you see them at Park Restaurants, The Love, Dandelion, Barclay Prime, Butcher and Singer, Budokan, and so on and so forth. And I can tell you, my interaction with the streets department and the building department has been quite positive. The streamlined process where we're able to get municipal approval for these and submit our building plans for them has not been difficult, although there's a little bit of confusion between streets and L&I on, kind of who's approving what. But the field inspectors for L&I have been out and they have visited us, as well as the health department. And, they've told us that we are meeting building guidelines. We are meeting COVID guidelines. So that's the only part that's a little bit confusing, because the permits actually have not been, issued in hand from the building department. The Eclipse system, and I imagine, going through COVID, it's a little bit difficult and things aren't going to be, as quickly coming out of L&I. But again, for the most part, our experience has been positive. We've worked really hard to make sure that not only the structures are COVID friendly for the public and our staff, but also that we're making sure that there's lighting and reflectors, and that the structures are built soundly, and that there's enough room in the city streets for trash trucks, delivery trucks, buses, and so on and so forth to get by. And we'll continue to build these things as we get approval. We're working with several city departments right now to get 13th Street to be a one-lane road, one-lane traffic road, because it's difficult. You can't build in a traffic lane without city approval. For example, on 18th Street, we worked with Rittenhouse Row and others, and currently 18th Street is a one-lane road from Locust all the way to Market. And it's enabled a lot of restaurants that are on the west side of 18th Street to build. And the restaurants on the east side are building anyway because that's the parking lane and they've gotten approval. And there's a nice wide 12-foot, 6-inch lane between the structures. that enable city traffic to go by smoothly without incidents. And even when some of the structures are too close together, we've been putting up those convex mirrors and little signs that say, hey, look up before you cross the street, because the mirror will help you in case there's oncoming traffic. I think what would help a little bit is some signs that say, changing the speed limit on some of these one-lane streets from 25 miles an hour to 15 miles an hour. But most vehicular traffic see these things and they slow down naturally. And that's kind of been my experience. I mean, I know there's a lot of restaurants that are using tents and fabric structures. They're not building wooden structures or aluminum structures, but there's certainly been a lot of creativity out there. And I think that, I personally have encouraged the restaurants that are near us and around us, to build these things where if a car would get a little out of control, that they're not going to, injure a pedestrian. And how that's done is with good lighting and lots of reflectors and people slowing down. I know in other municipalities where we operate restaurants, they're, making you put a barricade that's filled with stone or sand. I personally have been putting 300-pound planters in front of a lot of our stuff, because a 300-pound planter or two 300-pound planters will kind of stop a car going 12 miles an hour. But so far, there's been no accidents, no harm. But it's in the front of Star Restaurant's mind as we build these things that we're saving all the jobs that are in the restaurants, and we're giving the public a chance to have a little bit of a break for an hour and a half. But at the same time, public safety is important. So that's my little experience on what we've been doing. And I think that the efforts of most of these restaurants have truly been heroic. Bringing, in the summertime, bringing heater, umbrellas, and tables and chairs. They bring them inside and outside every night. The propane heaters. It's a lot of extra work for the restaurants, and from the most part, what I'm seeing is that everyone there's a real spirit out there, and with my experience, that spirit has extended to our interactions with the Philadelphia government, whether it's been health inspectors or L&I inspectors. I think all in all, we're doing a pretty good job. I'm working right now to try and get 13th Street to be a one-lane road like 18th, because on 13th Street, there's a bunch of restaurants on the east side of 13th, then there's not a parking lane, namely Charlie Was a Sinner, our restaurant Elvez, Zio Pizzeria, and if we can get 13th Street to be a one-lane road, then I know at Elvez we'll easily save 40 jobs and probably something similar at Zio Pizza and Charlie Was a Sinner. But that's been my experience. I can answer any questions if anybody has them.
Okay. Thank you, Michael Palermo. Thank you all for your testimony. I have a few questions. I want to start out asking Ben Falecchia from Pennsylvania Restaurant and Lodging Association and Nicole Marquis from Save Philly Restaurants. Have you both worked together to come up with these, I'm going to call it the smart restart of how restaurants could operate smartly going forward after January 1st? And have you met with the Commerce Department and the Health Department in order to see if we can get everyone on the same page? I think you're on mute, Ben. There you go.
Hi there. Thank you. We will meet with the Commerce Department on Friday. We're really pleased that we have what is looking like a task force being formed. The Commerce Department has been very helpful that regard. We hope to meet with the health department, and on Friday we'll talk about our top priority, which is the grants that are potentially coming out, and then also our data and research that we want to present to Dr. Farley regarding our exchange. There's technology and there's equipment out there to improve air exchange flow through restaurants, so that we do have a plan for after January 1st. So we hope that that's an ongoing weekly meeting, and we'll set our priorities on Friday morning.
I mean, I think Ben, I think you're okay now if you want to speak.
Sure. Completely agree with Nicole. You know, since April, we worked with each different division of the industry to create a program that's called the Pennsylvania Restaurant Promise, which just outlines a list of ways that restaurants can operate safely. Now, looking back at this, 9 months later, the things that we came up with before we all knew what was happening is actually working. You know, my greatest fear, and it has been realized with every, Nicole touched on this earlier, but with every new mitigation order that's come down against the restaurants, we've only seen an increase in cases. And, as Nicole said, the unintended consequences of not allowing these operators to do things as safe as possible is forcing, our residents into unsafe, unregulated places where we know social gatherings are continuing to happen. So, that is something that we definitely want to talk about. And then we see all the studies from, right now it's 6 different states that have submitted their contact tracing, robust contact tracing, that shows that in each of those situations, the spread of the virus is less than 2% at restaurants, and the spread of the virus is above 70% at unregulated spaces and indoor social gatherings. So, we're not saying that, there's not a one check solution here, but it's really frustrating as somebody who grew up in Philadelphia, who lives in Philadelphia right now, not only to see the and decimated as much as it is, but to see the mitigation efforts clearly not working. If you put a graph to what the mitigation efforts are and a graph to where the cases are, you see spikes and you see increases after each mitigation effort, and not just in Philadelphia, across the state as well. So, it's just really disappointing when you see so many people doing as the best they can to keep their employees safe and to keep the citizens of Philadelphia safe, and then it really feels like we're getting scapegoated and we're being called the bad guys. And listen, it is riskier behavior, but it's less risky than these indoor private gatherings that we see. I live in an apartment building at Broad and Washington. Friday and Saturday nights, there's parties in a lot of the rooms here where I knew, if the mitigation efforts weren't in effect, these places, these citizens would be out having their social gatherings in a space where there's people that are enforcing mask wearing, social distancing, contact tracing, no seat, no service. These things work. We know these things work. And, we just really like to get back on track in the safest way possible.
Because I think one of the main goals today, I know Councilmember Squilla discussed this, and so did many of my colleagues, is you know the industry better than any of us know it. So we're asking you to collaborate with our Commerce Department, our Health Department, and let's figure this out. We all want the same goal. We want it to be safe, but we also don't want to destroy our economy. We want to do it in a safe way. So on Friday, hopefully you'll come up with solutions. I would like to see you come up with solutions on Friday and try to get those approved so we can give people advance notice who are in business so they know what's coming down the pike, because on Friday is, I guess, December 18th, and we're 14 days away from what's happening in the city. So I'm glad you're meeting on Friday, and let's try to set a goal that we come out of that meeting with solutions on how we're going to move forward.
Yes, Ellen, Councilmember Allen, Councilmember Ellen Tom, I think that this is not, you're right, it's not safety versus economics. We can operate safely. And I think we completely agree with Dr. Farley that operating a restaurant as we did pre-pandemic is not safe. It would not be safe at all. But we need to discuss how and what are we going to decide on moving forward based on science and data so that we can operate and function our businesses. So.
Okay, well, that's great. Thank you very much. Thank you for your testimony. I do have a question for Lauren Gilchrist from JLL. Lauren, you gave a very good presentation, which is very, very powerful. And I guess my question is, some of the closures that were caused by the pandemic, especially in the retail sector, not the restaurant sector, but in the retail sector, they were advanced. They already were kind of on a tipping point, with the internet. They were advanced dramatically by the pandemic. And I guess one of the challenges for us in the city is, how do we reimagine this new space that's going to come on the market across the city? And from the city's perspective, we want to make sure that these spaces get occupied and people have that opportunity to have that space full versus vacant. What are some of the ideas that might be out there that these spaces can get reimagined into?
Well, the first thing I would say is that we had already begun to see a little bit of a shift to omni-channel retail strategies with some of the providers like a Bonobos, for example, who have essentially a showroom. And then you kind of walk in and you try on their goods, and then you essentially order them online and have them shipped to your home. So I do think we'll see ongoing increases in that type of retailer. What I would say, though, is the natural evolution of cities, if we kind of turn back to Jane Jacobs in the literature, is that cities go through cycles. And one of the cycles that will occur as a result of these dramatic vacancy rates is a decline in rents overall. And when rents decline, you create new opportunities for new entrepreneurs specifically to move into those spaces they may not have had the ability to do so before because the rent was too high. So I would strongly encourage the city to think about how they can lower the barriers to entry for doing business in the city of Philadelphia, whether that is with permitting or whether that is with technical expertise, or whether that is in what we choose to tax and how we tax it, in order to be able to, not only encourage, those new opportunities through lower costs in the form of lower rents for a period of time, but also to be able to create a broad-based access to what was and what will again be the nexus of the majority of consumer demand in Philadelphia.
So I think what I'm hearing you say, Lauren, is that some of these spaces will be reimagined with possibly lower rents, which from a city perspective, I guess, will mean that we might have lower assessments, which then means we might have to really look at this and say that means lower real estate taxes on the commercial end for the city. And that's something we probably really have to give a lot of thought to and figure out how that's going to work out. Is there any ideas on how to bring vitality back, not just in the center city, but I'm talking about even to the neighborhoods of 52nd and Market or Germantown Avenue right by Erie? And what can those neighborhoods do to bring vitality back, in your opinion? You're considered an expert in this area, so I want to tap into your mind and see if we can get some ideas.
Sure. So, I talked a lot about the business community and how the loss of office workers downtown specifically has resulted in a significant loss of retail demand. But what we're seeing in our neighborhoods shift a little bit as a result of working from home is increasing demand in those commercial corridors. And we've seen residential momentum increase, in and around Center City and pushing out into the neighborhoods more, as we had seen prior to the pandemic as well. And, those new residents, drive some of that demand for those commercial businesses in the neighborhood now more so than ever, because people are at home, they're at home more than just 5 p.m. to 6 a.m. They're home from 9 to 5, which they were not before. So I think what we've seen be really successful during the pandemic is takeout locations and locations that provide lunch service. Just in my own neighborhood, there's a number of restaurants specific that do not do lunch service because the majority of their consumers were dinner time consumers. And I think it's important for us to think about how we can support entrepreneurs with access to the technology they need to do delivery, the technology that they would need, to access the consumers that are increasingly in those neighborhoods, and to educate them, frankly, on the business opportunities that result from, doing restaurant service more than just 5 p.m. to midnight.
Okay. Well, listen, I want to thank you and the other panelists for your testimony today. It's very appreciative. We look forward to working with you as things progress. I don't believe we have any other questions from my colleagues at this time. So, Ms. Gerbach, please call the third panel of witnesses.
We have Teresa Iovine, Jeff Garcino, and Priscilla Luce.
Okay. Again, in the spirit of time, please keep your verbal testimony, if possible, to around 2 minutes, and then proceed with your testimony. State your name for the record, and I guess we can start with Teresa Iovine.
Hello, I'm Teresa Iovine. I'm here with my brothers Vinny and Jimmy Iovine, the owners of Iovine Brothers Produce in the Reading Terminal Market, as well as the restaurant Molly Malloy's, which operates inside the Reading Terminal Market. As a lot of you know, the Reading Terminal Market is a tourist attraction, as well as the longest operating farmers market in the country. We've basically the businesses here have been decimated by the lack of traffic in the building. We've been meticulous about implementing safety in the form of the acrylic barriers, separation between our seating. We've been diligent to make sure that the safety of our staff, customers, have been the biggest priority.
It's not only we're not only here representing just our family, which, we've been here 30 years now, in which one of my family members, are actually two of those, actually had closed down through the pandemic. I think we're also here representing the 70 other families in the Reading Terminal Market. The stress level of not knowing what's going to happen when, I guess for me personally, I was going to be submitted something, but Nicole did such a great job laying out that foundation. I'd be reiterating most of it. I guess for me, it's the communication, and when we know things are going to happen is the utmost importance. If they can work on keeping the percentage down for the delivery platforms, things like that, I guess it's really, it's just been tremendous it's been so hard to try and plan when you're being told 4 days you're done, or you're going to open up in January 4th now, but it's really going to happen. So it's such a tremendous stress on our employees. I have employees that we have to let off some. We're trying to really keep as many as we can.
I want to just interrupt you for a second. There's a little technical issue trying to hear you. I don't know if it's the masks or it's your equipment, but it's coming through muffled. Okay, thanks.
So we'll try that. Sorry about that. Is that any better?
Yes.
I apologize. So we are family. We're in our bubble. We've been together. We wanted to show that we're trying our best. That, not to go over too much, I guess, like I said, we're here not only representing the Iovine family, but the other 70 family businesses in the Reading Terminal Market. And again, by the way, I wanted to thank everyone for giving us this opportunity. But, Nicole did a fantastic job telling us, laying it all out. To follow her would be even tough to say. But I guess just some of the key things for me would be the communication, and when things are going to happen, any relief that is possible would be amazing. Down to even, my brother and I have even since downsized our homes and tried to refinance, but because we've taken PPP loans out, we're unable to refinance right now to try and keep things going. So we just wanted to stress the amount of stress that small business is really encountering is almost life-threatening sometimes, when I talk to some of the other merchants in the market. But again, I don't know if my family has anything to add, but I again wanted to thank you guys for your time.
Right. We've been listening the whole time, and we appreciate everything that everybody's doing, but it's truly a dire situation, and relief can't come soon enough. And I know you can do whatever you can, but
just keep us in mind, please. Reading Terminal's been here for 100 and some years, and it needs to stay here in Philly. And we will. It's a big part of tourism, and we love it here. Again, thanks again.
Thank you.
Thank you very much.
I just want to say, listen, we really appreciate you being there. We appreciate everyone in the Reading Terminal. I know Councilman Squill is in the hearing right now, and that's his district. I think you're even on the board, Councilman Squill, aren't you, of the Reading Terminal? So
Yes.
we appreciate all of you. Look, we want to help you as much as we can. And I speak for all my colleagues. We really, really want to help every business, new, existing, get through this period. It's nobody's fault. We're just unfortunate victims of this pandemic.
And the one thing I can say is our board, because Dawn is on that board as well, has been unbelievable. It's truly unbelievable how hard they're working. So I would like to thank them as well publicly. So thank you.
Thank you. Is it true the Reading Terminal Market's the #1 tourist attraction in the city? Is that something that
That is correct.
We flip-flop between us and the Liberty Bell. So right now I'm going to say we're not, but
We used to be
we used
for
to be
several
sure.
years, yes.
So yes.
okay. I think Councilman
But they
Squilla.
the events here at night too.
Yeah, I'm sorry.
Okay, great. Councilman Squilla?
Yes, and as you heard, the board's trying to do what they can, but it's not. We can't do enough, right? We know the suffering that's going on. We know what they put into place. Dawn has been a big help also. This is a reality of what's going on here. So as we reemphasize on how we deal with these issues, the main focus should be on, how do we help the smart restart? And I think that is something that is paramount right here to doing that. And we know about the physical health of the virus, but what we don't know yet is the long-term results of the mental, emotional health that is going to be impacted for years to come. So we have to also keep that in mind and do everything we can to help during this crisis. So thank you all, and then guys, thank you for hanging in there, and we'll keep trying to do things to get this up and running, and hopefully see that light at the end of the tunnel so that we can come through this together. So hang in there.
Thank you.
Thank you very much.
Thank you, Councilman. And I just want to say to Dawn Somerville, I know you're having that meeting on Friday with hospitality people, the restaurant people, and I hope from that meeting we can come up with a solution that's a smart restart on how we can get back on track with the health department. So I'm really hoping that that's going to be productive.
Yes, thank you. We're looking forward to the engagement.
Great. Thank you so much for everything. Thank you. And next, I'd like to call Jeff Guaracino from Visit Philly, who I'm sure is going to give us some great news about Condé Nast and other things going on in the city. Jeff?
Good afternoon, Chairman Dom, Vice Chairman O'Neill, and members of the committee. Thank you for having me today. In the interest of time, I will refer you to the statistics and my official testimony. I do want to do at a high level a few things. First is to say that I want to thank you and the administration for your action, your leadership, and the dialogue that we're having around the hospitality industry. I also want to thank you for your action on the support of Black and Brown businesses as we've launched our campaign in retail of Shop Black and Brown Business. The topics I want to talk to you about today are jobs for our friends and family, recovery via demand. You've heard demand come up a number of times. I've been listening the entire time. And of course, tax revenue. I'm a resident of Philadelphia. I know the budget is coming up, and I want to just talk to you about that. And I want to acknowledge and thank my colleagues in the restaurant industry who have been doing a Herculean job of trying to survive. And that also dovetails into the larger hospitality industry of retail, museums, attractions, live events, hotels, meetings, conventions, international, overseas leisure, which is what Visit Philadelphia does. And we know that when people come here, they need dinner before the show. They need 3 meals a day when they come here and stay in a hotel. So we want to thank you. But it is an interdependent industry, and the hospitality industry is united. The Convention and Visitors Bureau, the Visitor Center, the airport, the convention center. We've been meeting every other week to work towards our recovery, and the recovery is underway. I do want to say that, as you mentioned, We are a hot city. Travel and Leisure, Condé Nast Traveler, National Geographic Traveler, James Beard Foundation. We and you and our elected officials in health are working through a pandemic, but the recovery is already underway through our campaigns of Our Turn to Tourists. I know Greg Tarrant and his team are already working on bringing back Army, Navy, meetings and conventions, all of the regional residents who are no longer coming into our city as day trippers who are critical. And so I want to mention to you about the demand that can immediately help lift all boats. And this is not the first time that Philadelphia has had a major challenge, whether it's been 9/11, 2008. We have come together through smart investment in creating demand again through marketing and investment in the hospitality industry that has created an immediate return on investment, immediately in jobs, in generating tax revenue for the city and for the state, tax revenue paid by the tourists to fund tourism, marketing, and promotion, as well as recovery for all the for-profits and nonprofits who you're going to hear from. In my testimony, you will see that already that we are generating demand where we can during a pandemic for small businesses, 812,000 direct referrals from Visit Philadelphia to our museums, attractions, restaurants, looking more than 50,000 referrals to our small businesses in our neighborhoods, Black and brown and other retailers. You'll also see in my testimony the competition. And I want to mention this really quickly because this is critically important for our economic survival. Not only has Councilman Green mentioned to you that Baltimore, Florida, and New York have already launched economic development recovery campaigns for their hospitality industry, but our regional friends, and we're the Regional Tourism Marketing Corporation. So in addition to Philadelphia, we promote Bucks, Chester, Montgomery, and Delaware County. They have already received funding from the CARES Act, $2.5 million for Bucks County, $600,000 in Montgomery County, several hundred thousand in Delaware and Chester County, all with television and expensive advertising that is telling people to stay in the suburbs and patronize their businesses there. The competition from New York, Baltimore, and other places are going to continue to come, in addition to our own Commonwealth, where you'll see the Poconos and Lancaster already marketing and promoting their recovery. Visit Philadelphia and our colleagues are working on the recovery. You've seen some of our marketing that is there, but the hotel tax, as you mentioned, is decimated and it will come back. And we have an opportunity for that recovery to immediately show ROI for this council, for this administration, to get our friends and family back to work. And I'll end with this. We are your partner to the industry. We are your partner in recovery. We're happy to meet with you individually and as a council on the economic well-being of our city. I'm born and raised here. I went to community college and I had an access to go to a four-year college, and now I'm running Visit Philadelphia. This is an industry that 30 years ago, there was a vision to create jobs, tax revenue, support small business, and it has worked. So we are your partner. Please refer to my testimony about the data that you will need. And I want to thank you for your time and your leadership.
Thank you, Jeff. Great job and great presentation. Thank you. Let's go to Priscilla Luce from the Philadelphia Cultural Alliance.
Thank you very much, Mr. Chairman and all members of City Council. I'm delighted to be here to represent the arts and culture sector. We represent more than 460 arts and culture organizations in the 5-county region. 380 members of the Alliance are in the city of Philadelphia. Before the pandemic, you may be interested to know that this was a $3.4 billion industry that employed 37,000 in the city and delivered $157 million in tax revenue annually, so it is not an insignificant sector. As Jeff was saying, arts and culture is also an essential part of why the city has experienced a renaissance. Arts and culture drives both international and domestic tourism, and it has also routinely drawn residents into the city, which helps restaurants and retail. So as the 6-month shutdown occurred for arts and culture last spring, our arts and culture sector participants and members invested hundreds of thousands of dollars in health protocols, including PPE, air quality, and time ticketing to control density so that when reopening occurred, they could do so very safely. And in fact, that is exactly what happened. When reopening occurred, all of these protocols were in place, and we believe that we have very safe operations across the sector. And so the second shutdown, which occurred, has been devastating, and particularly this period between Thanksgiving through New Year's Day is when we get maximum numbers of visits from families in the region. So all of that has not happening now. And so this has thrust the sector into something of an extended crisis. I want to let you know that research that the Cultural Alliance just completed shows that more than 40% of arts and culture organizations view this upcoming period of January to March 2021 as the period of greatest financial peril for them. And this hasn't even happened yet. They're just looking ahead. And even more staggering is the scope of the projected revenue loss for the sector. Of the organizations that we surveyed, the estimated combined revenue loss between March 2020 and March 21, that is over the past 9 to 12 months, is in the range of $214 million. That's a 34% loss of revenue for the sector. In other words, a really huge impact. And that was before the second shutdown, which occurred on November 20th. So it's quite clear that without revenue generating opportunities, which the sector does not have right now, or some kind of emergency funding, we're very much at risk of losing a critical programming infrastructure that arts and culture provides. And possibly some institutions will start to disappear in 2021, which is an outcome that we most definitely want to avoid. Private philanthropy has helped us, but it cannot meet the total need of the sector. So I asked the city to consider accelerating the opening of cultural institutions after January 4th with all of the protocols in place that we've been discussing for the other sectors. Arts and culture stands ready to have all of those protocols in place for us as well, and to contribute to the discussion around what are good safety protocols. We've been working on this for a long time, and we can join as your partners in considering that. And also I asked City Council to, if there is additional CARES funding or general operating funds that can be provided for emergency support, we would especially like individual artists, small to medium-sized arts organizations, and organizations supporting BIPOC communities to be given priority in your support. And frankly, I'll just put it very simply, economic relief for our sector is imperative for our survival. So thank you very much.
Thank you. Priscilla, to ask you a question, I'm going to use it as a smart restart of cultural, the culture sector and arts. Have you, this has been researched, I assume, across the country, that what you're suggesting is a smart way to get back open?
Without question. We're ready.
Right. Have you met with the Commerce Department about that?
Not yet. We anticipate doing that. We had a very, very good meeting with Dr. Farley and the mayor's office as a start, and we would love to continue those conversations with the Commerce Department.
Can I suggest that, look, all we want, this goal of this hearing today is to get everybody together and achieve the same goal, but get the economy back on track in a safe way. So can I suggest in the next few days, maybe you all can get together, Commerce, Priscilla, and figure this out, meet with Dr. Farley, and let's try to get this opened up after the first of the year so that we can get back on track.
We would absolutely love to do that, and we thank you, Councilman, for suggesting this in your leadership and hosting this hearing. Thank you very much.
Sure, and I like Jeff, if you could be involved in that too with Visit Philly, be part of that meeting. I mean, as you said, Visit Philly is so crucial to all the other businesses in our city, and the feed off, no pun intended, to the restaurants and everything else is pretty powerful. So, and So I appreciate we can get that meeting pretty quickly. There is a sense of urgency right now. This is a sense of urgency. This is, by the way, and I think one of my colleagues said this, I think most businesses in general, and I think Councilman Jones said this, prefer that government doesn't get involved in their business. But this is a time when we need to get involved in order to help. And I think we're all prepared to do that. So let's try to make these meetings happen quickly. Let's get these things done in a safe way, get everybody's approval, and get back on track. Jeff, I have a question for you.
Yes, Councilman.
The convention business, I know, is a huge business for the city of Philadelphia. And I know in the last, I don't remember, 2 years maybe or so, where we booked a lot more conventions. And that business, produces a lot of revenue for the city and a lot of revenue for restaurants, hotels, retail, everything. At this point in time, can you give me some sort of picture for 2021, what that convention business looks like?
Yes, thank you, Councilman. As you know, the Philadelphia Convention and Visitors Bureau, Greg Karen, they oversee meetings, conventions, and major sporting events. And so he and I spoke this morning. So that is his area of responsibility, but the industry is united. So first, I will tell you that thanks to the way we have structured our industry here in Philadelphia, we have a competitive advantage. Other cities like New York and Vegas, who have over-relied on overseas or meetings and conventions, they are in big trouble. We have a strong leisure market, which will come back first, that will lead the industry's recovery. And that's what Visit Philadelphia works on. And we have very strong leisure. 88% of the people come here come for fun. Saturday night is the busiest night of the week. Meetings and conventions and groups will start to come back in late 2021. They book much later. And then that will come into 22 and to 23. So what's interesting about Philadelphia and our opportunity is that leisure this year in 21 will lead the recovery, help with tax revenue, help with jobs, help with getting people in restaurants, museums, attractions, and our image. And then as the meetings and convention business starts to come back, and Greg and his team are hustling, they are doing a great job over there, then the meetings and conventions come back to our hotels. And then Army Navy will come back. And then these other major events as we get into the 250. So unlike other cities, our strong leisure market convention group and meeting, and then the opportunities coming up is our competitive advantage. If we didn't have it right now, we could be looking at 2021 where we're all still suffering, but leisure will help. And then it gives the pathway for us to get meetings and conventions back. But I will ask Greg, Karen, and his team to follow up with your office specifically about meetings and conventions. I will say to you, the small groups, whether it's weddings, like leisure, that's a big opportunity for us and a built up demand. And people coming back to bring their own meetings and conventions here, or spending time as a tourist in their own hometown and rediscovering Philadelphia, is a giant opportunity if we take it. People are not going to take cruises in the short term. They're not going to be going overseas in the short term. People are taking drive trips. They can either drive by Philly to Baltimore, New York, and DC, or they can stay overnight and then come back. And so I think as we talk about recovery and demand and where marketing will come in, whether it's marketing to a meeting or convention or marketing to the leisure traveler, how we're going to get people back to work, build demand, and build tax revenue is getting people back here. And right now, they're not here.
So I appreciate that, Jeff. I guess one of my other questions is on the convention business. This may not be in your area. Most of these large organizations that book conventions book them, they know where they're going to be in 2025 at this point, or 2026. If they missed out on 2020 in Philadelphia, how do we recapture that business? I mean, do we go to then 2027, or are they going to slide all their convention years back? How do we not lose the business that was going to come here, especially with all the positive news that's coming out about Philadelphia, and they should come here?
I will say to you again, I'll defer the expertise to Greg Karen, but I will answer your question because we're lockstep. We talk all the time. The Pennsylvania Convention Center is a major competitive advantage for us by being downtown, and John McNichol and that team are doing a great job. Our hotels, which are expanding, are very competitive. They have been rebooking, as I understand, because they are laser focused on rebooking that groups, that they're doing a great job and leads are coming back. But no, every city is competing for those same people. On the leisure market, by us having strong leisure, that fills in and that helps drive all the other room nights. So again, I will ask Greg Karen to get back to you specifically on the strategies and their success. I will go back to one thing, the way that the hospitality industry was envisioned, the way we created it almost 30 years ago, is the reason why we're going to recover more quickly than other cities if we do it right. And that, sometimes Philadelphia is considered like, why do you do things your own way? It's because it works for us. And I will show you in the data. And as we rehire people in jobs and you see tax revenue come back, 30 years ago, those decisions that were made by members of council, the state legislature, governors and mayors, and leaders like yourself in the business community, we are going to benefit from now. So we'll get back to you specifically and to the members of council.
Okay, thank you, Joe. And I know that this convention business is important for arts and culture. It's important for hotels. It's important for restaurants. It's important for the whole city's economy. It's huge for our economy.
It is, and I'll just mention, when you look at big events where they rent out arts, I used to work at the Franklin Institute. When you have big corporate rentals like that, that is a game changer for them. When you have 25,000 people in the town, when we had the DNC, the RNC, Army, Navy, we're on national media. And then what helps us all year long are things that Visit Philadelphia works on, the advertising, the PR, the visitphilly.com website, what we do with travel and leisure. And as everyone knows in council, advertising is very expensive. So we need to continue to stay out there, and it all impacts each other. So the work that we do helps Greg and his team get people here. And the work that John McNichol does at the Pennsylvania Convention Center by being exceptional is the reason why they come back. And I'll just mention the Visitor Center, who is really suffering because they make their dollars when people buy tickets to museums and attractions and get on the big bus tour and go see Rocky. And so they are suffering because we do not have the visitation that's there. So as a follow-up, the industry, and every other Thursday we meet, I invite you, Councilman Dom, or anyone from council to join us if you need specific information or would like to address the hospitality industry. And thank you for your questions.
Thank you. I'm going to take you up on that, so thank you very much.
Thank you.
I want to thank this panel. Thank you all for your testimony today. We look forward to being in touch with you. And Priscilla and Jeff, I hope you have that meeting with Commerce and Health. And let's get sooner versus later. Sense of urgency.
Do that.
I will say that I live by something called DIN. Do it now. All right, so let's get it done.
Thank you.
Thank you.
Thank you all, council members.
Thank you. Ms. Gerbeck, let's call our next panel of witnesses, please.
Our next panel is Jennifer Rodriguez, Kate McGinchey, Gwen McCauley, and Philip Dawson.
Thank you, and please proceed with your testimony. State your name for the record, and let's start with Jennifer Rodriguez from the Hispanic Chamber of Commerce. Good afternoon.
Good afternoon, Councilman Dom. Thank you, sir, very much for having me here. I understand that time is of the essence, so I will not read my testimony in full. I will just skim through it to give you an idea. You have heard a lot of the opinions and testimony do align with the way the Hispanic Chamber sees the situation. I will, of course, start by saying that there are approximately 12,000 Latino-owned businesses in the city of Philadelphia, and that of these, nearly 40% are commercial quarter type enterprises, such as restaurants, hair salons, barber shops, and other retail concentrated around commercial quarters in North and South Philadelphia. And these, of course, have been most impacted by COVID-19. Examining the economic impact of these restrictions is crucial to our organization, and it should be, again, reinstated that recent safer at home restrictions will be catastrophic for many of these businesses. And we are sadly disappointed that key stakeholders, including our chamber, have not been consulted in the process of determining these recent business closures or restriction measures. In fact, we, diverse chamber, African American chamber, Asian chamber, the LGBTQ chamber, and the Hispanic Chamber issued letters related to this sentiment to Mayor Kenny and Dr. Farley, and we have not been contacted related to that. But here we are today, and it's important to note that As has been said, most of our businesses have really taken the measures that have been suggested and required by government. And unfortunately, they cannot afford to make additional cuts. And the remedies that have been offered by the city, such as the adjustment of the UNO, the delays in evictions and others, while fair, will not be sufficient to mitigate the revenue losses that amount to more than 40% on average for our businesses. They certainly not substitutes for sales. On a weekly basis, we have begun to hear of closures among Latino businesses or businesses that are at the brink of collapse. Because operating in this new normal is just not feasible. Barbershops that depend on walk-in business cannot operate, so their barbers set up shop in their homes. Event planners and caterers depend on in-person gatherings, cannot operate fully, but the parties still happen underground and unsafely. And then there are the bodegas that are too small to accommodate social distancing, and restaurants that don't have sufficient space for outdoor dining, which are then forced to migrate to delivery platforms that are expensive because their dining rooms are closed. When businesses work well and are allowed to operate, they not only build wealth for entrepreneurs, but they build wealth and improve the quality of life of the larger community. This fall, in an effort to support local businesses, particularly in South Philadelphia, we created Dine Latino Initiative, which also had a restaurant week associated with it. And we enrolled 22 restaurants. Those 22 restaurants received capacity and technical assistance to help them weather the pandemic. And in addition, we distributed $15,000 in small business grants and micro grants to those businesses. With adequate funding, of course, GPHCC can do much more to create and help create destination in South Philadelphia and support these businesses. This winter will be very difficult for Black and Brown entrepreneurs, many of whom will be forced to make difficult decisions about their businesses they have invested their dreams and resources in. Many of them will have to reduce operations, lay off staff or permanent close due to the circumstances outside of their control. Ensuring that we start planning today to position those that survive for success should be a priority. Thank you very much.
Thank you, Jennifer. I'm going to go through all the panelists and then we can have some questions. Let's go to Kate McGinchey from the Old City District.
Thank you. I'll try and keep this brief. Good afternoon, Councilmember Dom and all members of the committee. My name is Kate McGlinchey, and I am the Economic Development and Policy Manager for the Old City District. Like many Philadelphia neighborhoods, Old City and its restaurants have been severely impacted by COVID-19 and the related restrictions. Old City has already seen several restaurants permanently close this year, including neighborhood standbys such as Pharmacia. Additional restaurants have elected to temporarily close for the winter, creating more gaps on our commercial corridor. Restaurants fear that the coming colder months and the continued impact of the pandemic will have an even more devastating effect. Many restaurants have done their best to adapt with outdoor dining. Eateries and sidewalk cafes have popped up throughout the neighborhood, and Old City District runs a weekly street closure to create an outdoor dining room on 2nd Street. Outdoor dining has been a lifeline, with several restaurants expressing to our office that they would not have survived without it. We are incredibly grateful to City Council and the administration for these opportunities, and would be thrilled if outdoor dining allowances could be made permanent to give the restaurants more time and space for recovery. Unfortunately, outdoor dining alone is not enough to make up for the enormous economic damage of COVID-19. Our business owners understand and respect the safety reasons for the many restrictions, but many have struggled with the short time frame between announcement and enforcement. For example, the city's winter outdoor dining guidelines were not issued until mid-October, leaving restaurants unclear as to what heating equipment and shelters would be permitted. Undoubtedly, the administration worked as quickly as possible to release these guidelines, and we appreciate the quick responses we received to questions when these guidelines were published. But with cold weather approaching, the mid-October release left only a few weeks for restaurants to procure guideline compliance supplies that were in high demand. More advance notice of regulations, even a few days, would give restaurants time to understand and ask for clarification on these new restrictions and make the needed adjustments. According to our restaurants, unclear regulations and confusing enforcement have presented further challenges. Over the last few months, Old City restaurants have received multiple tickets and fines for their outdoor dining setups. These tickets are typically for minor issues such as string lighting, and the cost of these fines places an additional burden on restaurants already struggling to make ends meet. We understand the need for enforcement for safety and realize that there is always an adjustment period to new regulations. However, these fines can feel like salt in the wound to an already struggling restaurant. Clear guidelines and enforcement, and even relaxation of certain regulations to allow enhancements such as string lighting, could help our restaurants successfully host outdoor dining while remaining in compliance with city regulations. As we enter into the difficult winter months, we ask to work with the city to clarify these guidelines, provide more advanced notice of new restrictions to our restaurants, and perhaps make outdoor dining a permanent feature of Philadelphia's vibrant commercial corridors. We appreciate everything that the city has done to work with business improvement districts and our restaurants community so far, and we look forward to continuing to work on these issues. Thank you so much for the opportunity to testify today, and I'm happy to answer any questions. Thank you.
Thank you, Kate. Let's go to Gwen McCauley from the Manayunk District.
Hello, Councilman Dom. Thank you and your staff for inviting me to speak today and participate on behalf of my stakeholders. A week ago, I had Councilman Jones and Director Rashid, I think Councilman Jones referred to it earlier in testimonies, and many other city agencies out to Manayunk for a visit. It was really positive in light of all of COVID, and we were giving them our exciting vision and these initiatives that we have for post-COVID. And these are all great and positive stuff, but the key element is who will be here when that time comes. So with that in mind, I want to say good afternoon to all members of the committee. And I want to tell you that if you would have told me a year ago that Manayunk, the city, the country, for that matter, would be in the condition it is today, I wouldn't have believed you. What a difference a year makes. Now here we are, and I'm wondering, what does my district look like this time next year in 2021? Will we hold on to our occupancy rate? Will we lose any more merchants who can no longer hang on? Will a restaurant who opted to close down until the restrictions are lifted decide to stay closed? How will that affect his or her neighbors? Will this be a growing trend? Our restaurants are the driving force behind our district. Without them, we have nothing. In normal times, they employ roughly 1,000 workers on our mile district. It's roughly 1,000 workers, and it represents 50,000 transactions weekly. They're our lead economic driver, and they result in large percentages of secondary transactions as neighboring local retailer shops in the district. These add-on purchases are the lifeblood of our local economy. An example would be going into a restaurant and stopping at the eyeglass store to browse for sunglass selections, or picking up a card or candle while waiting for your table to be ready. If a restaurant fails, their employees lose their jobs. The storefront goes empty until the next low-margin restaurant comes in. But that's not even the end of it. The larger scale problem is the barber shop loses his customers, the retail shop loses their customers, the dry cleaner loses their customers. There's no parking revenue for us to sustain our district marketing efforts, and the barren storefronts makes incoming businesses reconsider locating there. It's such a domino effect, and we're fearful of the loss of a few key restaurants and that we could possibly not recover from it. We were the last county to open this summer, and the first in the state to shut down again on November 16th, or based on the November 16th ruling. It's resulted in 6 to 8 weeks of additional outdoor dining within the Philadelphia collar counties. Montgomery County, being less than a mile away from Manayunk, was hugely impactful to us. I believe this loss of revenue might have sealed the fate of some of our local restaurants. I'm asking the City Council to be aware of our difficulty abutting another county. Please be aware of the devastation you create by not maintaining the same guidelines as the rest of the state. Of course, our foremost thoughts are the eradication of the disease. But I wonder what harm this pandemic will have left on our district long after it's been eradicated. We're not a wealthy district, yet we're not the poorest, but yet we're not poor enough either. We receive little to no aid from the city and state, and yet we're trying to find our way. Many of our recent initiatives have been self-funded, including a matching winterization outdoor dining grant, which we match dollar for dollar any of the outdoor restaurants who wanted to winterize their streeteries, funding of security guards for Main Street during the civil unrest to provide a presence on the street that was not available for us from the Philadelphia Police Department. We think this really helped our district because it prevented us from boarding up, and it kept residents who weren't going to Center City coming down to the street. We think it was a hugely positive initiative for us. We've done a GoFundMe page for displaced employees and prize monies recently to incentivize our businesses to decorate for the holidays. And if you haven't been down on Main Street, it is lit up and looking lively. And so please just be cognizant of our plight and try to refrain from hurting us with overregulation and guidelines that don't match other counties. The outdoor dining through 2021 has been the best initiative that's come out of City Council this year. And our hopes are that you see a way to make these streeteries a fixture for a long time past the end of 2021 in order to help the restaurants rebuild and survive. So where we don't ask for money, we are asking for teamwork, where the city helps us maneuver this time in an effort to survive. We have already lost 20% of our gym and fitness centers who left the area for Montgomery County, and we don't want to lose anymore. So included in my testimony is an article, in my written testimony, is an article by my colleague, Leo Dillinger. And it was recently published in our Manioc magazine. And he quotes 5 business owners answering questions on why it's so important now more than ever to support small businesses. So in an effort to give you an idea of what our stakeholders are thinking, there is a gamut of different stakeholders here. A little retail shop, Brandy D'Asio of the Little Apple, who says, having been shut down for 3 to 4 months, many of us small business owners didn't even know if we would be able to reopen, and some sadly didn't. It was only thanks to the online support of our customers during the shutdown that we were able to pull ourselves together, get our doors open again. Now we hope to rebuild and to be there for our customers during the magical time of the holiday season and appreciate them choosing to shop small and keep our special little neighborhood alive and thriving. Robert Ashford of Unity Yoga says supporting local business at any time always means you're helping put food on a table, pay a mortgage, or investing in your neighbors. Now more than ever, in the face of COVID-19, supporting local means ensuring Manioc and Main Street stay vibrant and a destination that we're all proud to visit. It's amazing to know where your money is going and what you're supporting. And that's only possible when you shop and support small business. Sean Coyle from the Goat's Beard says the people who are employed by small business are at risk of losing their jobs. It seems so nihilistic, but it's not. You're going to see a lot of places, including independent restaurants, go under over the next 6 months. That's why we need to support them, because this is a tragic time in a low margin business and they need your help. Whether it's takeout, gift cards, or showing up, if you're comfortable showing up, they need your help. And Laura Ann Lampro of Lelab Philadelphia Retail Store says small businesses are the life force of the community. They give the neighbors they give the neighborhoods we live in character and charm. They bring an energy and a vitality to the street. They invest their hard-earned dollars back into the community. Now more than ever, it's so important to support the small businesses you love by shopping small, spreading the word to friends and family, and doing your part to tag and share on social media. Even the smallest actions can have the greatest impacts. Basically, we're just asking you to be our partner. We're asking you to work with us, and I thank you for listening and for your continued work on our behalf in small business.
Thank you, Glenn. Thank you. Next is Philip Dawson, Chestnut Hill District. Philip Dawson, are you there? Available? Or maybe there's some technical difficulty. While we're waiting for Philip Dawson to come on, I have a few questions I thought I could ask. And Jennifer Rodriguez, I wanted to ask you this question. You mentioned, I think in your testimony, that there was $15,000 that was utilized for some businesses in South Philadelphia, I believe.
Yes.
Tell me how that was utilized and how you decided, how that was granted to those businesses. What were their needs and how you determine their the amounts for each business?
Sure. So the chamber back at the very beginning of the pandemic created the R Plus Small Business Relief Fund. We received $15,000 towards that campaign from the United States Hispanic Chamber, and it was to be allocated in micro grants for small businesses. We know that there is, every time we have seen one of these grant programs being issued or created, that there is a major oversubscription of applications compared to the dollars that are assigned, which creates a lot of frustration because so many business owners are not able to take advantage of that. They actually become frustrated and stop applying for the grant programs. So we were very aware of that, and we knew that $15,000 would not be enough to distribute amongst Latino-owned businesses. So we decided that we were going to match the relief dollars to our Dine Latino campaign. So for restaurants that signed up for our restaurant week, we then made, those were 22 restaurants or 23, and then we said that they would be eligible to apply for this $15,000, which gave them a much greater probability of being selected. And we were very flexible. We were looking to see what they wanted to use the dollars for. We wanted the dollars to go towards something that would actually help the business continue operations. And so we were able to grant about 15 of those businesses grants between $500 and $2,000.
Okay. I'm asking that question, so I'm going to ask all three of you if you can either work together or work with other people in charge of districts throughout the city. I'd like to hear your suggestions on how we could support businesses, whether we have some money or not, or what are the things we could do. Maybe you just send us an email.
Sure.
And then we can connect, because we do want to help. So I think that'd be great. I think Philip Dawson's back on, so let me call upon him for his testimony.
There we go. Thank you, Councilman Dom. And thank you to the other council members and our district councilperson Bass for the opportunity to speak today. My name is Philip Dawson. I'm the executive director of the Chestnut Hill Business District. We include a bid and a community development corporation, and we serve over 225 small businesses around Chestnut Hill's Germantown Avenue corridor. Our district corridor is notable for not only serving the neighborhood, but also attracting significant visitation from tourists and the outlying counties. A 2017 e-consult report found that we had over 317,000 visitors a year in an average year, which sustains employment in our businesses and also provides important tax revenue to the city. The pandemic, of course, has changed all that. Our Chestnut Hill Hotel was closed for 3 full months. One of its 2 full-service restaurants is permanently out of business, and occupancy remains below 50%. Chestnut Hill's Woodmere Art Museum, another visitor magnet, has been temporarily closed during the current round of restrictions as well. As in all parts of the city, our small businesses have also weathered a historically challenging year. We've had a dozen of them who have permanently closed so far, and those who are still open have been both innovating and making some tough decisions to ensure their survival, whether that's laying off staff, moving to a smaller retail footprint, or making a foray into e-commerce or social media to try to find new customers. We did a recent survey of Chestnut Hill businesses who had applied for grant assistance, and about 2/3 of them reported that their revenue had gone down by at least 40% compared to the past year. And about 1 in 6 of them said it had gone down over 80% from the past year. And the most dire outlook that we've seen, of course, for the coming months is restaurants who continue to struggle with reduced staff trying to maintain takeout business and outdoor dining that is very weather dependent. Our organization over the past months has been very focused on connecting small business owners to resources and technical assistance, marketing the district, and maintaining our core services of clean, safe, and attractive. The information and assistance that we've provided has helped dozens of merchants to successfully apply for grants and loans. And we also started an independent grant fund under our Community Development Corporation that took in over $55,000 in donations, which we've distributed as direct aid to businesses who were struggling. And our staff continues to help businesses pursue new ideas to connect to customers. I want to mention that we've been especially grateful for the support of the city's Commerce Department staff over the past months, and for those city programs that have offered grants and other forms of help to businesses. Looking forward to the coming year, our businesses continue to hope for meaningful economic action from higher levels of government and also for financial relief and reasonable enforcement standards from city government. Business tax relief, reconsideration of the new trash fee, and more leniency in health department fees for restaurant inspection are all specific requests that we've heard in recent months from merchants on our corridor, which they feel would help to lessen the burden on those businesses who are struggling. Perhaps the most encouraging trend we've seen this year is that there have been new entrepreneurs who are still coming into Chestnut Hill and seeking to open businesses, even as some established businesses have been forced to close. So I think it's critical at this time that we do everything that's possible to promote their success and also protect those who are already here. And we look forward to collaborating with the city to promote the continued recovery of the district in 2021. Thank you.
Thank you very much. Thank you. Any ideas that any of you have, I mentioned earlier, on how we can help all your businesses in the district, please let us know. We are looking into making the outdoor streeteries permanent. We think it'll be a great addition to the city. We think it's a point of differentiation. And Kate, by the way, I want to thank you and the Old City District for all your cooperation working with our office. But we think that's a point of differentiation from the suburbs too. So we'll be back to you with that. We thank you for your testimony today, and have a great holiday. So thank you very much. Thank you. Ms. Gerbeck, let's call the next panel, please.
Okay, on this panel, we have Dr. Stephen Hunt, we have Osiah Sunday, and Shoshana Katz.
Thank you. And as I've requested from the other panels, please keep your verbal testimony, if possible, to around 2 minutes. And please proceed with your testimony and state your name for the record. And let's start with Dr. Hunt.
Hi, Alan. I'm not sure if Dr. Hunt's going to be able to hop on. Is he on? Stephen, are you on?
Okay.
I see he's on, but I know he's kind of in the middle of a couple cases over at Penn.
No problem. Osiah, do you want to go? Would you like to go next then?
Sure. Yeah. All right, let me get the camera on real quick. All right, so first off, thank you so much for your time, Councilman Dom. You've been really, really good in helping us from the Philadelphia Fitness Coalition. Just really navigate, trying to get in touch with the city as well as the health department. But once again, my name is Osiah Sunday. I'm the owner of Fit Academy, a Black-owned small business fitness studio here in Philadelphia, and I'm also a part of the Philadelphia Fitness Coalition. So I'm excited to be able to talk a little bit about my experience and as well as what's going on in our industry. And you'll also hear from another member of the coalition, Shoshana Katz, in a minute. So as you guys know, guys, this year has been incredibly challenging, and we recognize that it's been challenging for almost everybody that has been presenting across all different sectors. But, you know, right now, I think that small businesses here in Philadelphia, especially here in the fitness industry and wellness industry, this pandemic has been a situation that could be potentially fatally crippling and really eliminating the majority of our businesses here as we know it. So, you know, right now, as as it stands from the first shutdown, 1 out of every 5 wellness businesses has closed their doors, and they won't be coming back. And even my business alone was barely able to survive the first 4.5, 5 months of the shutdown. We had to make significant pivots, online, outdoors. Basically, we're doing every single thing that we could to generate revenue, but more than that, continue making the impact in our communities that we live in, which is one of the main goals for all of our businesses. We were able to take a little bit of the advantage of the PPPs and the EIDLs, but in the end, our finances went down from 100% down, and we lost like 70% of our clients almost instantly. And then our revenue dropped down to about 30%, which we had to somehow find a way to sustain that over time, which is extremely difficult. The biggest thing for me right now really is that the upfront financial costs are only really the tip of the iceberg. We're dealing with a really large issue that's more than just revenue loss. We're talking about loans, we're talking about mortgages, rent fees, taxes were also mentioned here. And the biggest challenge is, even though if we do take more loans, that just puts us even further in debt, especially now we're coming up on the second shutdown, and we're about 3.5, 4 weeks into the second shutdown. To add additional loans, it's going to make it even harder for us to get out of the situation. So for us, we're seeing that as a very scary thing. What we need is grants. What we need is relief, right? Whether if it's 1, 2, 3 months relief, something that just in the short term, when you look at it from a grand scheme of things, to have a business survive through this and be able to pay taxes over another 5, 10 more years is going to be much more beneficial than having a business shut down and not be able to give them 2 months of relief, right? So I really hope we're taking a look at this as the long-term play, especially as the vaccine comes up. For example, some stats that came from my business from July 27th to November 19th. We were able to open, and under really clean restrictions that we upheld to the highest level. But in the end, we weren't able to gain the financial, I guess you would call it, we weren't able to gain that financial gain back during that time, right? So now, the biggest thing that this second shutdown that has really impacted us is that it took away our major revenue season. It took away Black Friday, which allows us to really kind of generate revenue to get us through the summer for the next year, as well as the Christmas holiday, which now that was kind of the final lifeline that we had for this year of 2020, and that was gone. So a lot of us are now in a really, really bad position. And as you guys know, January is kind of the New Year's resolutions. So for the wellness industry, to take away that income is, a lot of us are really kind of scratching our heads trying to figure out how this is going to happen. People can't come to our gyms. We can't open up until January. And as you guys know, it takes anywhere between 3 to 4 weeks to really kind of ramp back up any kind of business after closing. So revenue still won't be normal until probably mid to late February if we were able to open up on January 4th. So, but when it comes down to it, the things that we were doing over the last few months that we were open helped us actually mitigate any kind of risk, right? So we put together a lot of different procedures in the studio that kept our clients safe. It worked. Some of the procedures that we put together were, for example, every single one of our visits are by appointment only. Now, granted, the fitness industry and the wellness industry does vary between big box, small independent owned gyms, different sizes across the board from, a couple thousand square feet to 20, 30,000 square feet. The next thing we did is, hey, if you're feeling sick, don't come to the studio. And we're also going to allow you to come to the studio. We also mandated clients to wear masks at all time. We're also doing temperature checks. Everyone must sanitize their hands upon entering our facilities as well as upon leaving. Plenty of physical distancing with 8x8s or more, depending on the location. No sharing of equipment, and no more than 10 people within a training room, right? And that includes teachers as well. So our class sizes are extremely, extremely small. On top of that, we have a ton of different types of HVAC ventilations, and we've rearranged our studios and our facilities to allow for ample airflow. So we have a lot of these systems already in place. And over the time, my studio alone, we had about 2,000 visits. We had 0 situations of infection of COVID-19 in my studio. Now, amongst the members of the Philadelphia Fitness Coalition, we've had over 40 members in that we've been gathering our data because honestly, we have some of the best contact tracing software, if you really consider it, because everyone has to come by appointment. So we have their information, their location, where they live, who they were in class with, who the teacher was, and we can contact everybody at a moment's notice. But out of over 400,000 visits, there's been a total reported cases of 35. That's less than 0.009. I want to make sure that's understood. That's less than 0.009% of visits. What does that mean, right? It means every single restriction and policy and procedure we've already put in place, it means it's working, regardless of not if the health department is actually going out and collecting the data or if we're self-soliciting it, right? Even at 100 times worse rates, we're still less than 1%. There's really not much more we can do when it comes to keeping our clients safe, right? And now we also understand that there are, some facilities out there that aren't following all the procedures, but even with that, the rates are still significantly low, right? So that's one thing that I think is really important to know. The procedures that we have in place are working, right? So our goal for the Philadelphia Fitness Coalition is to work with the health department to find a better way forward. We understand there's a lot of things going on right now with finances that are unsure, right? Any kind of funding, the timing that it's going to be coming. We don't know too much about that. But if there is a better way forward for us to either agree upon specific procedures that all fitness businesses are already doing, or adding more procedures to certify that they're doing it on a monthly basis or reporting their standards, we got to figure out what that next step is so we can save our own business. We need a shot to save our business because this is the first time since the first pandemic that we're actually even getting a seat at the table to be able to voice our concerns. So if we don't voice our concerns now and we don't give ourselves the plan to be able to make the change and survive this next shutdown, we won't be alive. 50% of us will die again. 50% of us, when it comes to die, I mean, 50% of our businesses will no longer be. Shut our doors for good. And that's a very, very scary situation because in the end, fitness and wellness facilities here in Philadelphia, we are responsible for the health and wellness. And I'm not talking reactive. We're not talking about healthcare systems. We're talking about proactive. We are the first line of defense when it comes to keeping our clients or our communities healthy and safe. Philadelphia has an obesity rate that's over 50%. We know COVID runs rampant with individuals that have comorbidities as well as are of minority, right? Unfortunately, based off of the demographics, blacks and minorities are those also individuals who are in the 50% obesity and high blood pressure and hypertension. What does that mean? We need to move. We need to keep people active, eat healthy, and keep their immune system as high as possible. Right now, we're in a situation where, look outside. It's snowing outside. Everyone is indoors. No one's moving. No one's eating healthy. They're grabbing the first thing that they see at the fridge, and their health and wellness is going to continue to decline. If we can't keep our clients and our communities moving and mentally and physically safe, COVID-19 is going to continue to be rampant amongst our community. So we have a lot of different questions that we want to hopefully be able to bring up and see if we can get some answers for it. I think some of the questions have somewhat been answered throughout this meeting, and we really appreciate everyone being as open as possible. The first one is regarding any kind of funding, right? We've already mentioned that a lot of fitness businesses did not receive it. That hurt a lot of people, right? If there is additional funding, how fast can we get it? Because 2020 is almost over. How fast can we get it? What's the actual procedure or process look like in terms of how do you become eligible? Are there already policies in place to be able to make the process faster? Can we make it less cumbersome for people, right? Another question I think is really important is, what are the actual targets for that January 1st or January 4th opening date, right? What's the expectation? Where does the city need to be when it comes to how many COVID rates, COVID numbers per day, in order for us to continue doing business, right? If not, how much longer is that pushback going to be? Will it be another 2 weeks, 3 weeks, 4 weeks? A lot of that information is going to be critical because now, unfortunately, most of our businesses can't really foresee past 2 weeks. We just can't. We're literally doing everything we can to generate revenue every single day. And to understand what that potential timeline will look like if we are able to open is going to allow us to figure out this holiday season, which has already been taken from us. And then lastly, I think that data is extremely powerful because the information that we've been able to gather showed that very, very low rate, which means whatever we're doing is working. If we are able to come to an agreement in terms of some sort of compliance, right? What does that look like next? Do we need to self-certify? Do we need to be submitting information on a monthly basis to the CDC because they don't have the resources to or to the health department because they don't have the resources to actually gather that? What does that look like? How many more hoops do we need to jump through in order for us to allow our businesses to be safe? And those are the kind of questions that I think that are really important, and not just for our industry, but for industries across the board. And my heart goes out to the restaurant groups because you guys are also being decimated. This is a tough time, but I think more than anything, we need to work together to allow us to save ourselves in the meantime while keeping our community and our neighbors safe. Thank you so much for your time.
Thank you, Osiah. Let's go to Shoshana Katz from BPM.
Hi, thank you so much. Thank you, Councilman Dom, and thank you everyone who is with us right now. Osai, thank you for kicking things off. My name is Shoshana Katz, and I am the founder and owner of BPM Fitness. And we're located on Spring Garden, right in the heart of the Art Museum and the Fairmount neighborhoods. We celebrated recently our 3rd anniversary in November, on November 18th of this year. And we were in the process of talking to a local developer here in the city about opening our 2nd location on Washington Avenue, which would have also served the Grad Hospital and Point Breeze neighborhoods. And those conversations were prior to the recent shutdown. On March 16th, we voluntarily shut our doors. Prior to the city mandate, like many of our colleagues, we chose to close before the city asked us to. This decision was incredibly difficult at the time, but we knew that it was the right choice to make to protect our staff and our members. Within 48 hours, we pivoted and we began to offer virtual classes. And this is, again, something that many of our colleagues did. This was not something that was done easily. There weren't many online platforms that could really handle what a fitness studio needs right away. There's a lot of back-end work in terms of signing up for a class, making sure the participants get the links, making sure everyone has everything that they need. And there just wasn't technology readily available for us to do that. So that was a bit of a learning curve for all of us there. We worked to create a schedule of about 3 to 5 virtual offerings a day. And in the very beginning, attendance was great. People were very into it. They were just happy to be able to be moving their bodies and have access to it. But over time, participation has absolutely dwindled. And also, we are faced with the challenge of competing with larger national platforms like Peloton and Mirror. They have millions of dollars behind them to create incredible on-demand live stream experiences where a place like BPM and other members of the coalition, we just don't have the funds and the means to afford to give that same kind of experience. That's just not our specialty. Online and virtual is not what we do. We specialize in the in-person connection and working with clients. Currently, BPM is bringing in around 40% of the revenue that we were bringing in exactly 1 year ago today. And that is up in comparison to what the last few months have been. Our gross sales for April were $7,000 of 2020, April of 2020, where April of 2019, they were 30. The drop is $7,000 doesn't even cover my rent. It's been difficult to maintain membership due to our diminished in-person options and our members' financial hardships. We can't charge the same price for a virtual option as an in-person class. And people are also continuously asking for extensions or refunds because they're just not sure when they're going to be able to use their purchased services. We developed multiple streams of revenue beyond our virtual class options and our outdoor class options. And we cut costs in every possible way. Examples of cutting costs, we got rid of our branded mobile app because it was $300 a month that we just didn't see worth spending. We changed insurance companies because it saved us several $100s a year. I mean, at this point, all of our businesses are in survival mode, and I know that that is a shared experience between everyone here today. It's surviving and getting through this. Paying our coaches was our top priority, and we were very fortunate to be able to continue to pay our coaches since shutdown, and that was able to be done initially because of PPP loans, and we were very lucky to be able to receive that. But as we all know, that's a very limited time in which we had that money for, and we had to use all of it by the end of June, and we are in December. Our front desk staff, we had to let go in terms of pay, but we also continued to pay any staff member who depended on BPM solely as their sole source of income. During the few months that we were able to reopen, so gyms were allowed to reopen at the end of July. BPM chose to reopen in the middle of August just to give it time to see how things were playing out. And when we felt that, there had been no issues with compliance, there were no issues with COVID cases, it was safe for us to reopen. We reopened in August. And so from the middle of August through November, we had over 1,176 indoor visits. We had one client bring a COVID case into our facility, and we had 0 transmissions. And this was because of the diligent best practices that we and many of our colleagues have in place. These best practices, I know OSI reviewed some of them, but just to reiterate, they include, and they're not limited to, masks must be worn in the studio at all times, and there are no exceptions. Temperature checks are taken upon arrival. We require hand sanitizing upon contactless check-in, as well as any time a participant or a member entered or exited any part of the fitness studios. We have 2 studios of BPM. If they entered the cycling studio, they had to hand sanitize. When they exited, they did as well. We reduced the capacity of classes to less than 50%. There were no more than 10 people in an individual studio at once. And to give you an idea of the size of our studio, each studio is about over 1,500 square feet. We required advanced signups, so there were no walk-ins and there were no late entries into class. Spaces were clearly marked in class, and members had to remain in their designated area at all times. Every person in the strength studio had about an 8-foot by 8-foot box. There was no shared equipment. Everyone had to have their own and sanitize it once class was complete. Class schedules were spaced out to provide for ample cleaning and ventilation in the space. Doors to the studios remained open at all times. Staff sanitized all high-touch surfaces during every shift and between every class. To give you an idea, that's roughly about 3 to 4 times per day. And all of the products that were used were EPA-registered disinfectants and sanitizers. We communicated with clients and staff that if they felt sick, they needed to stay home. If they came in contact with anyone who tested positive, they had to remain home until they had a negative COVID test. And all of my staff were tested monthly for COVID-19. The restrictions that fitness studios have been enforcing are some of the strictest in place among many brick and mortar businesses here in Philadelphia. We create a controlled environment where contact tracing is easily done. Again, like Osai said, because of our systems that we have. You have to sign up, and when you sign up for classes, we have all of your information. And we know when you come into the studio, we know who has been in class with you. When we had that one person come in with a COVID case, we were able to contact everyone that they had come into contact with in the studio within 48 hours. So that's 2 days worth of clients, and everyone tested negative. There were no issues. We've always maintained a high level of cleanliness as well as expectations from our community. And while we have had 0 issues with compliance, we're also not afraid to have the hard conversations to make sure that it's enforced. Every small business is being forced to make a really hard decisions right now. And every day that passes, another one is being forced to make the heartbreaking decision to close those doors for good. With every closure, it leaves more citizens of our city unemployed, more vacant commercial spaces on our blocks, and it gradually decimates our local economy. I know Osai started with some questions, but to reiterate, what do you need to see in terms of data and science-based facts in order for us to be able and allowed to safely reopen? What do you need from us to prove compliance? We have been told that they just don't believe that we are following the rules. What can we do to show you that we are? How can our industry, specifically the small locally owned studios, be represented when it comes to making decisions that affect our industry? We have been left out of the conversation literally up until this point, and we are 9 months, almost a year into this. And the fact that we are now just entering the conversation, while frustrating, I'm really happy to finally have a chance to speak, but we need to be involved in these conversations. And lastly, how can our industry get much needed financial support? And again, not in terms of a loan, because we're already carrying so much debt, as many of us are, but forgivable grants. How are we able to get this financial support to allow our businesses to reopen safely? Thank you so much for your time.
Thank you, Shoshana, and thank you, Osai. And Osai, I just want to reiterate something that I think I heard you say, and that was it over 400,000 visitations and 35 cases? Was that the number?
That's correct. Yeah. We had, the exact numbers was 439,000 visits from July till November 19th. And it looks like it's 36 reported cases of COVID. It's less than 1%.
Right. And so, I mentioned at the beginning of this session today that I had a lot of written testimony from fitness centers. I think I had 10 testimonies that were submitted in writing, and it's including RIP Philadelphia, Lumos Yoga, Unite Fitness, Subversus, Focus Bar, Yoga Habit, Warhorse, Wall Cycling Studio, CKO Kickboxing, Open Box Athletics. And when I looked through the testimonies and read them, those that submitted information, there were 16,200 visits, and in those cases, there was only three COVID cases out of 16,200. So I think you make a pretty strong point. I mean, I'm sold on it. I'm also want to read into the, as part of this record, the letter from Dr. Stephen Hunt from the interventional oncologist, University of Penn, who is in support of fitness enterprises as an essential business and believes that fitness centers should be opened with the proper guidelines. So what I'd like to see happen, I'm not sure if Commerce is still on because this has gone pretty long, but we can try to set up, Shoshana and Osai, a meeting with both of you, with the Commerce Department, with the Health Department, and do exactly what we're asking the restaurant people to do, and that is come to the meeting with what you believe are the safest ways possible to reopen, what the guidelines would be, and see if the Commerce Department and the Health Department, you guys can come to an agreement and we can get you open. Our goal is to make things happen and get this done. And I will tell you that I agree with you on the health and fitness. I noticed from my own personal story, I wear a Fitbit, and typically I average 10,000 steps a day, but during this pandemic, I'm down to like 3,000 or 4,000. So clearly, we're not as healthy as we were before, and fitness centers are important. Anyway, I want to thank you both for your testimony. I want to thank Dr. Hunt for sending in his testimony. I don't believe there's any public witnesses today. So I'm going to close with just a few comments, be very brief, but today has really showed us that there's a lot of work that goes into the survival of an extremely important business such as the hospitality business. And whether it's restaurants, whether it's hotels, whether it's fitness centers, arts and culture, or Visit Philly, or any of those cultural organizations, they are so important to our economy. We have to make sure that they survive, every one of them. And so hopefully today we can connect those institutions, those businesses with the Commerce Department, the Health Department, and come out with a safe restart. But I'm really looking for this to happen this week. We can't really wait till next week. It's got to happen now. And I want to thank everybody for their time today. And as I've said before, we'll be stronger through this if we stick together. And I hope these conversations today will lead to hopefully better communications, decision-making, but really having solid, concrete ways that businesses can reopen in a safe way. So this concludes the hearing on Resolution 200699. The hearing is adjourned. Thank you very much, and be safe out there with the weather. Thank you very much.
Thank you, Councilman.
Thank you.